Finally, we are live. Sorry about that. Welcome everybody once again. And welcome to the Own Your Health program. And the topic for today is, how do my medicines work? So, my name is Flora, and I'm the founder of Encapsulate Healthcare Solutions and the convener of this Own Your Health program. The vision of the organization is to provide solutions for healthcare needs of Nigeria, not just Nigeria, but the whole of Africa in a few ways. So one of the ways is to provide training to healthcare professionals to improve wound management. And the other way is this public health awareness program, On Your Health. Learning is lifelong. So we need to continue to increase our knowledge on various things. And I believe of health is definitely one of those areas. So this is why this program is here, On Your Health, to empower you, but it's not just for you, it's for you to be able to empower others around you with the right information. In this digital age that we're in, there's a lot of misinformation around. So it's always good to have the correct information, the facts that you can pass on to others and to use for yourself, so that you can make better decisions about your health and, of course, for the health of your family. So here we are. Welcome once again to Own Your Health. I am going to start now and introduce our first speaker. She is a clinical pharmacist based in the heart of Croydon in London. I was going to say London, but Croydon, UK. She is self-driven. She enjoys mentoring young people at various stages in life, on a variety of topics, from career progression, achieving your goals, renewing your mind set in order to achieve success. She's driven by all things governed by passion, progression, and efficiency. She is Nikki Adeyemi, pharmacist with many years experience. The floor is yours.
Okay. Good afternoon, everybody. Thank you, Flora. Thank you, Encapsulate Health, for inviting me to speak today about how our medication works in our body. I hope, everything that myself and the rest of my colleagues discussed today empowers you and you learn one or two things. And please remember to write questions in the chat. So if you don't mind, Flora, if you could put the presentation up, please.
Just 1 minute, let me share the screen.
Thank you.
Okay. Can you see this screen share?
Yeah, I think you just need to.
There we go.
Thank you very much for that.
I'm trying to find the
F5?
Yeah, there we go. Slideshow. There we go.
Okay, so as I said, hello, my name is Nikki Adeyemi. I'm just going to go through the journey of the medication. I'm only going to speak on the first few topics of how medications work, and then my colleagues will take over. Thank you. So, pharmacokinetics is something, is sometimes described as what the body does to the drug and refers to the movement of the drug into our bodies, through our bodies, and how it comes out of our bodies. So next slide. Yeah, so this is just the product. This is just the outline of what we're going to be talking about. So the different administration, absorption, and distribution of the drug. Yep, next. Yeah, so as I was saying before, pharmacokinetics is described as what the body does to the drug, and it refers to the movement of the drug throughout, and outside of our bodies. And here is just the best definition I could find. So it just talks about, the absorption of the drug, the distribution of the drug, how the drug is metabolized, and how the drug is excreted. So this is just a very generic description of pharmacokinetics. And like I said before, myself and my colleagues will go into this as we go on. Next slide. Okay, so before a drug can be used for purpose, it must first be administered. So there are many different routes that a drug can be administered, as shown in the diagram on the screen. The most common route of administration is usually orally via tablets, capsules, or liquid syrups. And this can also be done through the intravenous route, which some people call a drip. So every route of administration has its own advantages and disadvantages, and one may be favored more than the other for different reasons. For example, if somebody has swallowing difficulties, the oral route will not be suitable for that patient, so an alternative route will need to be sought. In addition to this, different routes have different rates of action. So in an emergency, it might be suitable to give a patient a medication right into the vein so it can go straight into the bloodstream, as opposed to a tablet that once it's administered, it needs to first be broken down before it's circulated around the body. Yeah, next slide. So I'll just quickly go through these routes again quickly. So as I mentioned, the oral administration, this occurs when the medication is taken through the mouth, is swallowed, and is absorbed via the digestive tract. Some of the medications sometimes have like an outer layer to help withstand the acid in the stomach, so it can reach the target organ, so for proper absorption. And again, oral tablets are the most common route of medication and the administration, and is the least expensive form. We also have buccal. This one involves medication being placed between the gum and the cheek, and this is used when the chemicals of the tablet, it dissolves into the gum and then is administered that way. So that's also another way that medication can be used. So that's oral and buccal. Next slide, please. Then we have the rectal. Some medication can be given through the anus, and this can be used for patients who have, for example, constipation and they can't swallow, or they need something that is fast acting. So we have some things called enemas where you could put up in the anus, and this would dissolve. This can dissolve the feces and help it come down. And then again, you have the intravenous route that goes straight into the vein, and that goes straight into the bloodstream, so you have fast absorption. Next, we also have intramuscular. So intramuscular goes straight into the muscle, and it goes into the muscle for absorption to happen. We have next slide, please. So we have the otic, so that's, eardrops. Inhalation, for example, you have the inhalers. Subcutaneous, that's also another form of injection that's given into the subcutaneous layer of the skin. Then you have conjunctival, so that's like eye drops. Everyone's familiar with eye drops. And you also have nasal. So you have the nasal sprays, the nasal drops. These are all routes of administration for before a drug can be absorbed. Next slide, please. So absorption. So after the drug is administered, it needs to be absorbed by the target cells before it can carry out its therapeutic role. So absorption is the process of delivering the drug into the bloodstream. Note that if a drug is administered through the IV route, so the intravenous way. So again, that's, some of you may commonly know it as the drip, where you see the bag hanging by the patient's side. That's usually intravenous. That goes straight into the bloodstream, and that that doesn't need to be absorbed. That goes straight into the blood, as opposed to the tablets, the nasal spray, the rectal form. All of these need to travel before they get into the blood, before it's absorbed. Okay, so some drugs, have to move across the cellular barriers, and it moves the drugs from an area of low concentration to an area of high concentration. So that, in a sense, means that some drugs, before it can be used, it needs to go from an area where there's not that much to an area that there's higher concentration, and vice versa. Things that may affect it may be the size of the particles of the drug, the solubility, and how much it can actually cross into the bloodstream. And another thing that can affect the drug's rate of absorption is the presence of food. So sometimes if there are some drugs, for example, flucloxacillin, which is an antibiotic, its rate of absorption is decreased if you have food in your stomach. That's why when you're given that sort of medication, the doctor will say, take it on an empty stomach. An empty stomach will be 1 hour before food or 2 hours after food. And this is solely because of the rate of absorption. If you have food when you have such drugs, not only Fluclox, there's so many, it can reduce the rate of absorption and how much drug is actually being used. Okay, so the next slide. So going back to that example of the flucloxacillin, there's this thing we call bioavailability. So bioavailability is the actual amount of drug that reaches the target organ or the target space without being unchanged. As I mentioned, when you're taking a tablet, it has to travel around the body before it reaches that place where it needs. So for example, if it's the knee, it has to travel around the body before it gets to the knee. And before it gets to the knee, a lot of that medication would have already, been lost. So bioavailability is the amount of drug that reaches the knee unchanged, so it can be used. Okay, so again, things that affect bioavailability is absorption, the way it's absorbed, the actual particles itself, how it's made, and food. Going back to IV, the bioavailability of the IV drugs will always be 1. So that's always going to be 100%, because it doesn't have to travel through, different components before it reaches the bloodstream. It goes straight into the blood. Next slide, please. So now we have distribution. So once the drug has been absorbed, they need to be distributed around the body. And sometimes this distribution requires proteins to move around. Okay, so as I've written here, so it refers to the physical processes of binding to proteins or partitioning into fat and tissues. So things that affect this protein binding is the concentration or should I say the amount of protein or the available sites that the drug can bind to. So let me just recap that again so I don't lose anybody. So in order for the drug to travel to the target, it needs to bind to a protein. Not every drug, but most drugs need to bind to a protein. Okay, so for distributions, for it to be distributed. So what can affect this protein binding is the amount of protein available and the how likely the drug is to bind to that protein. So we call it like affinity. So how the attraction between the proteins in the body and the drug, that can also affect how much it binds. So in order for a drug to be used, it needs to be free flowing. So it has to be free flowing, for example, and it's these proteins that make it travel around. Sometimes these proteins can act as a storage bank. So if the drug is binded to these drug, the drug can be used later on. So that's why you have some drugs that have longer longer duration in terms of, okay, let me not go too deep. So some drugs you have to use twice a day. Some drugs you can use once a day. The difference of this is because of it has how long it is in the body before it's broken down. So stuff like protein binding can help. So if a drug can be bound to a protein for a longer period of time, that means you don't need to take more. So you don't need to get a second dose because the protein acts as a bank. So it can be released slowly into the body so it can be used. Next slide. So this slide is just, as I'm rounding up, it's just a recap of what I've just said. So as you can see where it says administration, so the drug, it goes from prescription to administration. So your doctor gives you a prescription and then you administer it through the whatever route it's been prescribed for. Then you have your bioavailability, is absorbed, then is distributed through the body. And on the picture on the left, you can see there's different ways it can be distributed. Once it's distributed, it has its effect. And then my colleagues will discuss the rest of the process. So I hope that all makes sense. So what I've just in essence spoke about is how the drug is administered, the different ways it can be absorbed, and how it can be distributed. And then I'll pass on to my colleagues to finish the rest of the journey. Thank you. Just the next slide, yeah, that's done.
Thank you very much, Nike. Are there any questions for Nike? Any questions for Nike? All right, if we have any more questions later, you can just type them in the chat and we can take them later on.
We've got one question.
Okay, go ahead.
Do the medicines stay in your body forever?
No, I'll answer that one, but my colleagues will go into that later. They don't stay in your body forever. They have the intended effect. Once they've done their job, they're excreted out, and my colleagues will show you how they're excreted out.
Okay, I think that's all for now. So if we introduce the second speaker, please.
All right, fantastic. Okay, so we move along the body with this journey with the drug. And our next speaker, I'm increasing the anticipation. She's looking at me saying, get on with it. Our second speaker is a clinical pharmacist with 20 years of experience in different areas of pharmacy. She's currently working as a respiratory and antibiotic lead pharmacist. She's also one of the clinical authors of the NICE clinical knowledge summaries, which are guidelines written to be used by doctors in general practice and other healthcare professionals. So Ikoma Odeja, you're welcome to the program. It's over to you.
Thank you very much, Flora. I will just share my screen. Okay, can you see my screen? Can you see my screen, Flora?
Yes, we can see your screen.
You can? Okay, great. Okay. Okay, so hello, everyone. Thank you so much for coming. My name is Ikoma Udaja, and I am a clinical pharmacist based in Manchester. So I'm going to take over from Nike and basically discuss what the medicine actually does when it gets into the body, okay? So, okay. So, as part of my presentation today, we'll basically look at what a medicine is or what a drug is. So I'm going to use that term interchangeably throughout the whole of the presentation. And then before we can actually understand how the medicine works in the body, we have to kind of understand how the body works. So I'll give a very, very brief talk on how the body works. And then we'll go into how the medicine works in the body. So it's going to be a general overview. I'm not going to talk about individual medicines because different medicines work in different ways. So I'll just try and give a general overview on how the medicines work in your body. And then we'll look at side effects. We'll talk about why they happen and how we can reduce the risk of side effects. And then hopefully there'll be a chance at the end for you to ask any questions. I just want to point out that for this presentation, I'm only going to be dealing with the legal drugs. So kind of the illegal drugs like cocaine and stuff like that, I won't be dealing with because I believe they'll be dealt with in a future presentation. So I'll just focus on the legal drugs, okay? So what is a medicine? So medicines are chemicals or compounds that are used to cure, to control, to prevent a disease. You also use them to ease symptoms or help you to diagnose an illness. So I'll talk about these individually. So if we talk about cure, if you have a chest infection and you go to your doctor will prescribe you, will assess you, and then prescribe you the correct antibiotics to treat that chest infection. So if you take the antibiotics properly and how the doctor has told you to take it, it will cure that infection and it will, get rid of the bacteria and cure you from that infection. So you may have the infection again later on, but that particular incident will be cured. So let's talk about control. If your blood pressure is very high and you go to a doctor, the doctor will prescribe an antihypertensive. So what this drug will do is to try and control your blood pressure and get it to a safe level. It doesn't cure anything. There's nothing to cure. All it does is it just controls the blood pressure so that you don't get the complications of high blood pressure. So if we look at prevent, if, for example, you don't have certain drugs prevent you from getting an illness. So a good example is vitamin D. So vitamin D is a supplement that if you don't have it in your body, in an adult, you can develop something called osteoporosis, which is when your bones are very brittle and your bones can break easily. So if we take vitamin D supplements, it will reduce our risk of getting osteoporosis or any other condition related with not having enough vitamin D. Another example are vaccinations. So the whole point of taking a vaccination is to actually prevent yourself from getting an illness. So if you vaccinate yourself, then you prevent yourself from getting the illness that you vaccinated yourself against. And even if you do get that illness, well, the hope is that it won't be as serious as perhaps if you were not vaccinated. So you can also use medications to ease your symptoms. So if you have pain, you take a painkiller. That's quite easy. It doesn't really cure anything. All it does is it helps you to manage the symptoms until whatever is causing the pain gets better. Now, this last one is quite interesting. So we're not using the medicine to cure, we're not using it to control, we're not using it to prevent anything or to ease your symptoms. What we're actually using it to do is to help us to diagnose a condition. So for example, if you go to an optician and they have an eye test, sometimes the optician will put a dye in your eye. So the reason why they do that is if, for example, you have a scratch or some kind of injury in the eye, that dye will collect in that injury so that the optician can actually see where the problem is. So in that case, you're using the dye to actually diagnose the condition. Another way is if, for example, you had a patient and you're not quite sure what that patient has, you can give them a drug. And if that drug doesn't work, then you can say, okay, well, maybe they don't have that condition. So if, for example, if you have a patient who has headaches, who has a headache, and you don't know whether that headache is from a brain tumor or if the headache is just a migraine, you can give that patient a drug from migraine. If it doesn't get rid of the migraine, then you can investigate them for a brain tumor. So it's better to do it that way because there's no point spending the money and the energy doing a diagnosis for a brain tumor if the person just has a migraine. So in this way, you've used the medicine to help you to diagnose that condition, okay? Now, I will talk about how the body works. I know this diagram will probably be scary to a lot of people, but I will really do my best to keep it very, very simple. So a cell is the basic structural and functional unit of all living things. So plants, animals, humans were made up of lots and lots of cells. So it's estimated that the average human has anywhere from 20 to 100 trillion cells. So we have a lot of cells, and each of these cells has an individual thing, a different thing that it does in your body. So when you have a group of cells that look alike and do the same kind of work, you call that a tissue. So we have about 4 different types of tissues in in our bodies. I'm not going to go through them or what they do, but basically the tissue is when you have a group of cells that do the same thing. So when you have a group of tissues that do the same work, we call that an organ. So in our bodies, we have round about 78 different types of organs. Some of them are vital, which means that we can't live without them. So your heart, your brain, those are vital organs. The rest of them, you can live without them somewhat. In fact, one or two of them, we don't even know what they do. Like your appendix, it's one of the organs, but we don't quite know exactly what it's doing in the body. So when you have a group of organs that perform the same work in your body, we call them the organ system. So we have about 11 different types of organ systems. One of them is your digestive system, for example, which is made up of your mouth, your stomach, all those organs that come together to help you digest your food would fall under the digestive system. So basically the cells, the tissues, the organs, the systems, all these body functions, they all work together to make sure that every living being can perform the 7 life processes. So if every living being has to be able to perform these 7 life processes, and that's movement, reproduction, sensitivity, which is being able to feel things, growth, respiration, which is being able to breathe, excretion, and nutrition. So every living thing has to be able to perform these 7 processes. And the cells, the tissues, the organs, and the organ system all work together to help us do this. Now, in order for them to work together, they have to be able to communicate. They have to be able to communicate with each other, to tell each other to do things at different times. So for example, the cells from your brain will send a message maybe to the cells in your kidneys to tell them to do something. So there's constant communication day in, day out. Even when you're sleeping, the body is still communicating and doing these things just to keep you alive. Now, sometimes the cell can do the work itself. It doesn't need any help. It will just do it if it's made to do that job. But if it's not made to do that job, then it will communicate that job to another part of your body to do the job, okay? So how do the cells communicate? If a cell needs to communicate, it does this by sending a chemical message. So it basically sends a specific chemical message into the blood, and it will go to the organ that it wants that message to go to. So the cell that wants to send the message will get that specific message, and it will send it to another cell called the target cell and tell that cell to do the job. Now that chemical message will go straight to the target. It won't go to anywhere else, and it will only do the job that it has been asked to do. So I'll give you an example. An example is pancreas. So the pancreas is one of the organs in your body, and one of the jobs of the pancreas is to control the sugar that is in your blood. Now, everybody has to have a certain level of sugar in their blood. If that sugar level is too high, there's a problem. And if the level of sugar is too low, then there's also a problem. So the job of the pancreas is to keep an eye on your blood sugar to make sure that it's exactly where it needs to be. If you eat a piece of meat or fish and meat don't typically break down to sugar, so your pancreas won't do anything. But if you eat a bowl of rice or a bowl of pasta or some bread, your pancreas now gets to work. So what it does is it will release that message, that chemical message. In this case, it will release insulin, and the insulin will go to the target cell. So it will go to either your liver or to your muscles or to your fat and cause that cell to take in some of the sugar, because there's too much sugar in the blood, and that's not good. It doesn't like it. So it will send that insulin to go and speak to the cells of the liver, the muscles, and the fat cells to tell them to take some of the sugar in so that the balance will be maintained. If on the flip side, you don't have enough sugar in your blood, the pancreas will send out a sister hormone called glucagon. So it won't send out insulin this time. It will send out glucagon, and it will send glucagon to those same cells to tell them to release some sugar. And the pancreas does this all the time because the job is to keep your blood sugar balanced. So let me try and explain it using this diagram on the screen. So this is basically what this is what the human cell looks like. And as you can see on the cell, it has this thing sort of coming out of it, and it's called a receptor because it receives the message. Now, the receptor can either be on the cell or it will be inside the cell. It doesn't really matter where it is, but it will have a receptor. And what happens is that when that message comes, the message will sit on the receptor and cause that cell to do whatever it is that needs to be done. So if you can see, this particular cell can only receive one type of receptor because of the shape. And the same with this second one, it's shaped differently. So it can only receive a message that is shaped, that will fit into that receptor. Now, this third one is a cell that has two different types of receptors. So it can fit a message that is round, and it can also fit a message that is diamond shaped. So if I use this third one to explain the action of the pancreas, if you have too much sugar in your blood, your pancreas will release. So let's assume this is insulin. It will release the insulin, and the insulin will sit on the proper receptor and cause that cell to take in some of the excess sugar. And if on the flip side, you have too little sugar, then the pancreas will not release insulin. It will release the other one, which is the glucagon, and that will sit on the glucagon receptor and cause the cell to do the opposite thing. So this is basically how the body works all around to keep us balanced. Now, if there's any problem with your pancreas, because obviously things happen and, maybe your pancreas breaks down or whatever. So if your pancreas is not working, so if it doesn't release insulin when there's sugar, or if it doesn't release enough insulin, so in this case, we have 5 blobs of insulin. So what if your pancreas just releases 2 blobs of insulin? Well, clearly that's not enough to deal with your plate of rice. Or if it releases it, but when it gets to the site, it doesn't quite fit, something happens and it doesn't quite work, then you need a medicine to help you. And the medicine you need, when the manufacturers actually make this medicine, they will target it to work in a particular way, either to cause your pancreas to release more insulin or make these cells of your liver or your muscles more receptive to the insulin. So this is where you would need a drug, because obviously your body is not doing the work fine. So anybody who faces this situation where either the pancreas is not working or they're not having enough, the pancreas is not working properly, they really have 3 options. One option they have is to just stop eating sugar. Stop eating anything that has sugar, and then your pancreas doesn't have to do anything and it's all fine. But we know that's not very practical. So the second option they have is, keep eating the rice and just prepare yourself basically for the consequences of high blood sugar. So we know things like, if you have high blood sugar, diabetes, we know all the consequences of diabetes, amputation, blindness. If you decide that that plate of rice is worth it, then you can just carry on eating it. The third option you have is to take a medicine to actually help your pancreas or help your body to process that sugar. So in the first slide, or in the first 1 or 2 slides, I mentioned that sometimes the cell can do the work itself. It doesn't need to send anyone if it can actually do the work itself. And it does that, one of the ways it does that is by using something called enzymes, okay? So again, I'm taking us back to biology, but I will make this as painless as possible. So an enzyme is basically a protein that speeds up a chemical reaction. So a good way to explain it is, in my house, when I try and cook beans, and I know in a lot of people's houses as well, they use potash or account to speed up the beans so that it cooks quickly and it uses less gas or less electric. So that's what an enzyme does in your body. So a lot of the processes that happen in our body, some of them take a very long time and will take a lot of energy to complete. So when that cell, the cell will release an enzyme to speed up that reaction, just to help your body to speed that reaction up, okay? So an example is an enzyme called lactase. And lactase is responsible for breaking down lactose. If you take anything that has lactose, so like dairy products, your milk, your cheese, your yogurt, your body, the cells in your digestive system will release this lactase to help your body to break down that dairy product, okay? So I'm going to use this diagram here again to explain to you how the enzyme works. So if you imagine that this blue shape here is the lactase, the enzyme has a kind of like a space on the side where something can fit, and that thing you call it a substrate. So if this is lactase, the only thing that can fit into this is lactose. So when you have a dairy product that has lactose in it, it will fit into that enzyme, and then in the middle, they do a little reaction, and then it will break that lactose into a form that your body is happy with and your body can use, okay? So if you eat another type of sugar, if you eat galactose or sucrose or anything else, this particular enzyme will not do anything because it's not responsible for those sugars. It's only responsible for breaking down your lactose, okay? Now, again, if there's a problem with your body, and maybe your body is not making enough lactase, or your body is making lactase, but it's not working properly, then you need help. And again, you have three options. It's either you stop eating anything that has lactose, so you can buy lactose-free milk or lactose-free yogurt, or you eat the yogurt and just, again, be prepared for the consequences of not having enough lactase. So some people get diarrhea, some people get constipation, some people have a lot of gas. Or you get some lactase supplements, you can get them from the health food shops or whatever, and have them and try and see if that can help you to break down the lactose, okay? So when in a healthy human being, all these processes in our bodies, our breathing, everything we do works well together, there's no problem. There's no need for medications, there's no need for anything. Unfortunately, as we get older, and with some of the lifestyle choices we make, so some of us perhaps drink too much or we eat too much, we don't exercise enough. And also sometimes our genetics as well. Sometimes we can't control it. That's how we're born. Because of these things, sometimes things can start to go wrong. So some of the things that can go wrong, I've already described in the previous slides. So sometimes that cell that wants to send the message may not be working as it should. So maybe it's not producing enough of these chemicals to send, or maybe it's producing the chemical, but the chemical is not working very well. Sometimes it might even be producing too much of the chemical, which is a problem because the body likes balance. It doesn't want too much of one thing or too little. And then maybe the problem is not with the sender cell, maybe it's with the target cell. Maybe that target cell is not working properly. Maybe it's not reacting to the chemical or it's overreacting to that chemical. So if any of these things happen in your body, then that body needs help in form of medications, okay? So how do medicines work? So most drugs are designed to actually target those cells that, you know, the picture I showed you before, the drugs are designed to target those cells in a particular organ or to target a certain enzyme. So a drug manufacturer will think, okay, what do I want to treat now? Do I want to treat diabetes? So they will make sure that their drug will target that organ that they're trying to treat. So you take the drug goes down the body, just like Nick explained, it gets carried in the bloodstream, okay, looking for the cell that it can fit or the enzyme that it can fit into. So as a pharmacist, I always get asked this question, oh, how does the medicine know that the pain is in my leg? Or how does the medicine know that the pain is? The truth of the matter is the medicine doesn't know where the pain is. All the medicine is doing is just traveling in your blood and just going to where it will fit. So you can imagine it's like a thief, for example, who is just walking down the street, looking and trying all the doors to see if anyone will open. And if it opens, they go in. So that's how these medicines work. It's just going down your bloodstream and it's looking for where it will fit. So if it sees a receptor or an enzyme, it will try and fit. If it fits, fine. If it doesn't fit, it keeps moving. And that's basically what happens. So it doesn't know where it's going. But when it gets to a receptor that will fit, just like I showed you in the previous picture, or if it gets to an enzyme that will switch, it will sit on that receptor and it will either cause it to switch on. If it's not doing what it's supposed to do, it will switch it on. And if it's doing too much, it will switch it off, depending on exactly what that's, what the manufacturer wants to target. So if, for example, the body is producing too much of one thing, the drug will switch off that cell. And if perhaps the drug is, the cell is not producing enough, the drug will switch on the cell. Okay, so this brings me quite nicely to another way that drugs, so what I just described is how a lot of drugs work. But not all drugs work like that. Some drugs work in other different ways. So I'll describe another two ways that drugs can work in our bodies. Some drugs actually work on the actual site that is needed. So they don't do anything fancy. They don't do anything incredible. So for like antacids, for example. So if you have heartburn, it's because your stomach acids are kind of bubbling away and it's disturbing you and it's causing you to have that pain. So if you take an antacid, all it does is it will just neutralize your stomach acid and the pain will stop. So it's not doing anything fantastic. It's just neutralizing your stomach acids, okay? Another kind of drug that works like that is your laxative, so things for constipation. Some of the drugs for constipation, literally when you take them, all they do is bulk up your stool so that it's easier for your body to pass it. They don't do anything with your receptors or anything fancy. They just physically work on the problem. Another way that drugs can work in the body is some drugs actually target certain types of cells. So they're not looking for a specific receptor or a specific enzyme. They're looking for cells that work in the same way. And a very good example is drugs that are used for cancer. So cancer, as we know, is when the body cells are dividing very, very rapidly. So a drug manufacturer might think, okay, I'm going to design my drug to kill off every cell that divides very quickly. And that's how a lot of cancer cells work. Unfortunately, when it gets into the body, it doesn't differentiate. It's just looking for cells that are dividing quickly. And another type of cell in the body that divides quickly is the hair cells, which is why a lot of chemotherapy drugs also cause hair loss, because they don't know what they're doing. They're destroying every cell that is dividing quickly. So yes, they're killing off the cancer cells, but they're also killing off your hair cells in the process. Antibiotics are a good example as well. When you take an antibiotics, you're basically saying to it, go into the body and kill the bacteria, a certain type of bacteria in the body. Now, we know that oh, can you hear me? Can you still hear me? Looks like
Yes.
Yeah?
Yes,
okay,
yes,
so we know that our body is made up of lots of bacteria. Some of them are actually very useful. So some of them we need in our stomach to help us to digest food. Some of them we need in our private bits to help it to be clean and, and so when you take the antibiotics, sometimes it goes in and all it has been told is go in and kill a certain type of bacteria. So it doesn't care whether it's the good one. It doesn't care whether it's the bad one. It's just following instructions. And that's why sometimes after you've taken an antibiotics, you can end up getting other things. You can end up getting thrush because the antibiotics has killed off the good bacteria and the fungus can grow where it's not supposed to grow. So basically, this is just to basically explain that the drugs are not that clever actually. The brains behind the drugs are the manufacturers and the people who are actually prescribing these drugs because they know what they're trying to treat, so they know exactly what to prescribe. And this takes me very nicely to side effects and why side effects happen with drugs, okay? So side effects happen. One of the reasons why we get side effects is because apart from the target receptor, so when you take a drug, nothing works as good as the natural thing. So when your body is doing all the sending of the messages, it will send the receptors to the chemical to the correct place. It won't send it to anywhere else. Unfortunately, when manufacturers make drugs, they try the best they can to target a specific receptor, but it doesn't always work. So as the drug is moving with your blood, it can accidentally fit into receptors in other parts of your body and cause those receptors to do what they're supposed to do. And that's why we get side effects. That's one of the reasons why we get side effects. So a good example is a drug called Atenolol. I don't know if a few of you may know this drug, which is used to to reduce your blood pressure. Now, Atenolol has been designed to work on a receptor in the heart that is called the beta receptor. So as it's going down the bloodstream, once it gets to the heart, it will sit on the beta receptor and cause your blood pressure to go down. However, we also have beta receptors in our airways. So when it's moving, it will also sit in beta receptors in the airway. And this time it will cause breathing problems. And this is why if somebody has asthma or any issues with their breathing, it's not advisable for them to take Atenolol because yes, it will reduce your blood pressure, but then you may have an asthma attack and die. So you have to kind of weigh things and decide which, and this is why you have to make sure that the medication you take has been recommended by a healthcare professional because they will do all the necessary assessments to make sure that that particular medicine is good for you. They'll take into consideration if you have any other illnesses, how old you are, before they can give you that medication. Now, sometimes the manufacturer will try and design the drug to make sure to try and stop it from getting to other sites, but it doesn't always work. And that's why, there's nothing you can do. You just basically try and make sure that you take the medication that has been prescribed just for you to reduce the chances of side effects. Another way that we can get side effects from drugs is by the actual physical effect of that drug on your body. So the actual contact of the drug. So some drugs are quite corrosive, they're quite harsh. So something like doxycycline, which is an antibiotic. If you take doxycycline, it can sometimes irritate your stomach or irritate your food pipe. And that's why it's recommended that you're upright or standing when you take doxycycline, and that you take it with a full glass of water. If you decide to lie down when you take doxycycline, then you run the risk of burning your food pipe or even your stomach just because you haven't actually listened to the instructions on how to take the medication. Another way that you can have side effects is by that medication interacting with maybe something you've eaten, a drink you've had, or even another medication. So an antibiotic is called Flagyl or metronidazole. If you take it with alcohol, it will interact with the alcohol and cause vomiting. So if you didn't take it without alcohol, you wouldn't vomit. You would just obviously just take your drug and go about your business. But if you take it with alcohol, then it will cause a side effect to happen, which is vomiting. And warfarin is a tablet that is taken to thin the blood. And erythromycin is a type of antibiotic. Now, if you take these two together, what the erythromycin will do is it will reduce the body getting rid of the warfarin. So a lot more warfarin will be left in your body because these drugs don't stay in the body forever. They have to leave at some point. But if you take erythromycin together with warfarin, it will keep the warfarin in the body, and then it will increase your risk of bleeding. Because remember that the warfarin thins out your blood because it doesn't want you to have a blood clot. But if you leave it for too long, then you start bleeding. So if you have an injury, maybe the injury won't clot properly. And so you have to be careful when you take certain medications together to reduce side effects. And another reason why side effects happen is just purely because of drugs work differently in different people. So people of different ethnicity may break down drugs differently. People of different ages break down drugs differently. So we know that very young children and very elderly people, they probably don't need as much of the drug as people in sort of the middle age. We know weight has a lot to do with drugs. So some drugs actually dissolve in body fat. So if you may have to give a bigger person a bit more of that drug to get the same effect. And we also know that genetic makeup also is quite important. Certain genes make it possible that you can process your drug quicker, or it slows down the processing of the drug. And of course, disease state. If your kidney is not working properly or your liver is not working properly, it's going to affect how quickly you break down this drug, and it can also increase your chances of getting side effects, okay? So how do we actually reduce the risk of side effects? So the first thing is, if you can use any other dosage form, use it. So Nick here talked about the different dosage forms that are available for medications. So if a drug exists as a cream and as a tablet, and you can use the cream, then the healthcare professional will advise you to use the cream, because you're just going to apply the cream to where you need it. It's not going to travel into your blood, and there's the risk of it attaching to somewhere else where it's not supposed to. It is minimal. The same with inhalers, because you just spray the inhaler, again, it's not traveling into your bloodstream. So if it's possible to use that medication in another dosage form that is safer, then do that. Now, the second thing is use the recommended dose. Don't use more and don't use less. The manufacturers So the manufacturer, they do their calculations to work out how much of this drug will give you the best benefit with the least side effects. So they've already done the calculation for you. You don't need to do it yourself. They've already told you how many of these tablets to take that will give you the best effect and will give you not too many side effects. So if you go playing around with your doses and, oh, actually, let me take 2 or let me take this, then you run the risk of having side effects with those drugs. And actually, the problem sometimes is that you don't, what the drug does in your body doesn't actually improve, but what you're doing is now increasing your risk of having a side effect. So a very good example is paracetamol. Paracetamol is a wonderful, wonderful, wonderful drug. Very, very safe. It can be used by children. It can be used by elderly people. It can be used by people who have different medical conditions. However, if you use paracetamol if you don't use it as recommended, which for adults is 2 tablets 4 times a day, paracetamol can very, very quickly turn from being a friend to an enemy. So if you take too much paracetamol for a long period of time, it can actually damage your liver. So you have to make sure that you take your medication as the right recommended dose by the healthcare professional. And on the flip side as well, if you decide, the doctor tells you to take 2 and you decide to take 1, then you're not quite reaching they've done this calculation, and they've worked out that 2 tablets is what is going to give you the best effect. So if you reduce it to 1, you basically halved the effect that you're going to get, but you're still going to get the side effects. So you must make sure that you take the recommended dose. Another one is to use it for the recommended duration of action. If we say 1 week, please use it for a week. If we say a month, please use it for a month. If we say every day for the rest of your life, it literally means every day for the rest of your life. If you don't do these things, then you're not going to get the best results from your medications. And I think finally, the last one, I know one of the other speakers is going to go very deep into this, but you have to use it as directed. If we say with or without food, you need to do that. If we say you should sit upright, there's a reason for that. And sometimes I know people open up their capsules and remove the medicine inside to use it. Don't open up your capsules unless you're advised by a healthcare professional, because you don't know why that drug is in a capsule. Sometimes it's in a capsule because it doesn't taste nice. Like paracetamol. Paracetamol is very bitter, and the manufacturers sometimes put it in a capsule so that it's easier for people like me who don't like medicine to be able to take it. But so in that case, if you open up your paracetamol and bring the capsule out, it's not so bad if you can take the taste. But some medicines are put in capsules because they're quite corrosive to the body. So if you open up the capsule, then you're increasing your risk of having side effects. So medicines are put in capsules because, if they're not protected, the stomach acid will destroy the medicine. So if you open up the capsule and drink it, then it's not going anywhere, because once it gets to the stomach acid will destroy it. So I suppose the message is, if you don't like the feeling of a capsule in your mouth, ask for a version of the drug that is not in a capsule if it's available, or just confirm from your healthcare professional whether it's okay to open that capsule and take the medicine out. So one thing I want to point out is that all medicines, I say almost in bracket because I have a feeling that somewhere there's a medicine that doesn't have a side effect, but I don't have an example. So for now, I'm just going to say that almost all medicines have side effects. Most times we can tolerate them. Most times we don't even know they're happening. We're just going about our business and the side effect is happening. But sometimes the side effect can be so bad that the medicine has to be taken off the market. So one example is a medicine called Reductil, which we used to prescribe in the UK for weight loss. And it was a very good tablet for weight loss, but they found that it was causing the people to have strokes and heart attacks. So they thought about it and they're like, okay, there's no point being a size 8 if you're going to die of a heart attack. So they pulled that medicine from the market. But another thing I want you to take away is that not all side effects are bad. Sometimes you get good side effects. So there is a contraceptive pill called Dianet. If you take Dianet and you have acne, Dianet will clear the acne. So that's a side effect of acne, which is a good side effect. Another drug called Xalatin, which is used for glaucoma, if you use that, it will cause your eyelashes to get thicker and longer. I don't know about the rest of you, but for a woman, that's quite a good side effect. And I suppose a very, very popular one is a drug called sildenafil, which is marketed as Viagra. So in 1996, when Pfizer made sildenafil, the point was for it to be used for blood pressure. So they designed it to go to the blood vessels in the heart and open up the blood vessels so that your heart is not working as hard, and so it reduces your blood pressure. So when they were doing the trials for Viagra, the nurses that were going around checking all the patients found that the men in the group, every time they came to check the men were a bit embarrassed and, so they found out that these men were having erections at the same time. So when the Pfizer people, all the scientists went back and they looked, they found out that as well as opening up the blood vessels in the heart, the Viagra was also opening up the blood vessels in the penis, and it was causing these men to have erections. So Pfizer decided to rebrand immediately because it was going to make them a lot more money to sell a drug that helps with erectile dysfunction than to sell a drug that helps with blood pressure, because there are lots of drugs out there that help with blood pressure. So in 1998, they rebranded Viagra. And instead of being a blood pressure tablet, it's now a tablet used to treat erectile dysfunction. So if somebody takes Viagra for erectile dysfunction, one of the side effects is that it will reduce that person's blood pressure. So if the person is somebody who has hypertension anyway, then that side effect is a good thing. So I think the take-home message is, yes, side effects will happen. Let that not put you off taking your medication. If sometimes, most times we just get on with the side effect and we don't think about it. Sometimes it can be a good side effect, but one thing is, if it's a bad side effect, it will be picked up and then that medication will be taken off the market. Okay, so if you don't remember anything else that I've said today, I just want you to remember these final points. The first one is that our body is an extremely intelligent machine. Our cells, our tissues, our organs, and our organ system work together to keep us alive, to keep us well. If anything is not working, then we need medicines to help us. Medicines do not know where to go. They're not that clever. What happens is that the blood will just carry it around the body, and when it gets to a receptor or an enzyme or where, anywhere that there's a problem, it will just sit on that receptor or sit on that enzyme and it will perform the desired action. Medicines work differently in different people. So depending on your age, depending on your ethnicity, depending on how healthy you are, all these things can affect how a medicine works in your body. Almost all medicines have side effects, whether good or bad, and you have to take your medicine as directed to reduce the risk of side effects. And I think the last point I want to make is that there's a very, very fine line between a medicine and a poison. And I found this quote online, which said that the difference between a medicine and a poison is actually the dose that you take and the intent. So why have you taken it? Are you taking it for the right reasons? Okay, so I hope this has been clear. Please let me know if you have any questions. Thank you very much.
Awesome. Thank you so much, Ikoma. That was fantastic. Do we have any questions for Ikoma, please? I hope we do. Many questions. Bumi, do we have any questions? You're on mute, Bumi.
Apologies. Just to make it more interactive, I'm just going to read one out. I'm going to read a few that we've got here, but if you've got questions, I'll say feel free to just speak. The first one is there a way to predict whether a medicine will cause a side effect?
Well, so you, the person taking it, will not be able to. So unless you have some kind of medical background, it's not that easy to predict. But every medication will have instructions from the manufacturer. And if you read the manufacturer's instructions, it will tell you whether or not the type of side effects that you can expect to have with those medications. So you won't be able to sort of just by looking at the medicine tell, but if you read the instruction that comes from the manufacturer, it will tell you whether or not side effects will happen with your medicine.
Thank you very much for that. The second is, why do you take aspirin with a full glass of water?
So aspirin, again, one of the side effects of aspirin is that it can cause bleeding, and it can also cause sort of in your stomach and stomach discomfort. So if you take it with a full glass of water and with food as well, then it will kind of protect, it will make sure that aspirin goes down quickly. And then if you take it with the food, it will protect your stomach from those side effects of bleeding and, of abdominal discomfort.
Thank you so much. Someone says, well done, Ma. Everyone loves your presentation, by the way.
Thank you.
So can vitamin D be too much in the body?
Yes, it can. So there are two different types of vitamins. You have the water soluble and you have the fat soluble. So the water soluble vitamins, if you remember from biology, ADEC and BC, so the A, D, E, and K are the fat soluble ones. So you have to take the correct amount because it will get soaked into the fat in your body and build up to a toxic level. So it's not easy to get toxicity from vitamin D, but it's possible. But things like vitamin B and vitamin C, your body will just wash off the excess that it doesn't need. So it doesn't matter what you take, the body will get rid of the excess. But the fat soluble ones, you have to be very careful.
Thank you so very much. Now we've got lots of beautiful presentations. We're loving it. I understand that the high blood pressure medications generally makes the user urinate often, and that passes out sodium or salt from the body system. Can one talk a lot of water? Okay, I think it's, can one take a lot of water to flush out the sodium or salt and stop the medications? Let me read it again. I understand that the high blood pressure medications generally make the user urinate often and passes out sodium or salt from the body system. Can one take a lot of water to flush out the sodium or salt and stop taking the medications?
So it's not all blood pressure tablets that cause you to urinate or go to, to pass water. In fact, the blood pressure tablets that make you pass water are not really the first choice. We only add those towards the end if the others don't work. And it's because perhaps your blood volume is too much. So there's too much liquid in you, if you like, and sometimes your body is a bit swollen. So then we'll give you those tablets to get rid of some of the water, because if it gets rid of some of the water, then your blood is not working so hard. Your heart, is not working so hard, pushing the blood around the body of minerals and things like that. But when you eat, and the body will balance itself out. You don't need to sort of take additional salt or or things like that. So and again, your doctor that puts you on the medication will monitor you constantly. So they'll look at things like they'll do blood tests, look at your sodium levels, look at your potassium levels, and if things are not balanced, you don't need to usually when you don't have enough sodium or enough potassium, your body will give you symptoms. Your body will always give you signs when something is wrong. So if you don't feel well, if you wake up and you kind of feel, God, I'm a bit dizzy today, or I'm just not feeling right, go to your doctor. They'll do the right blood test. And if your levels are not right, they will sort you out. You don't need to do it yourself because you don't know what you're doing. If you decide to put a lot of salt in your food, and then you might tilt things the wrong way. It's always best to let a healthcare professional deal with the problem. You just deal with yourself and how you feel, and make sure that you look after yourself as best as you can.
Nikki, you wanted to say, sorry, Nikki, you wanted to say something?
No, I think Ikoma already answered that question with regards to the sodium and the water intake. So I think she answered it perfectly, so it's fine.
Great, thanks.
The next question is, can I stop a medicine by myself if I get side effects?
Okay, that's a bit of a tricky one. I think it depends on the side effect. So it depends on the side effect. I would always say speak with your healthcare professional, because the thing with some of these side effects is sometimes when you start a medication, the side effects will be so bad the first few days, but if you give it a few days, your body will adjust and it will get better. So if you stop a medication every time you get a side effect, then, but again, it depends on the side effects. So if I take a tablet and I suddenly can't breathe, I will be very reluctant to take that tablet again. But one thing I'll advise is, if you know your own body and you know what's happening, so if you take a medication and you think, no, this is crazy, I can't breathe, and you decide you're not going to take that medicine, you must tell your healthcare professional, because you know what, you don't have to suffer in silence. There are other medications that we can try. So if we try one and the side effects is too much for you, we'll just switch to another one. It's better that you're still on your medication than that you stop completely, and then whatever it is that you got that medication for will then become worse. So I suppose the answer to that is, try not to stop your medications without getting an advice from your doctor or your pharmacist or a healthcare professional. If the side effect is one that you think, no, I can't take this anymore, it's too much for me, then contact your doctor and say, or contact your pharmacist and say, I've stopped this medicine. This is why I've stopped it. And then they will be able to prescribe something else that will manage that same condition and hopefully not give you the same side effects.
Thank you so much. I think I'm going to take this one. Then the next one, I would get people to put their hands up so that it's a little bit more interactive.
Sorry,
so that's
last one. We need to move on. We'll take the rest of the questions at the end, please. Thank you.
So it says, what is the side effect of taking vitamin C overdose?
You can't really do a vitamin C overdose because, like I explained before, the vitamin B and C are water soluble. So once your body takes what it needs, the rest you're just basically, so if you take too much vitamin D, you're basically flushing your water down because your body will just get rid of what it doesn't need. It's the other ones, the A, D, E, and K, which are the fat soluble ones. Those are the ones that can become toxic in your body. So you can take as much vitamin C as you want. It's up to you. But if you read the packet, it will tell you when you hit your recommended daily allowance. Anything over that, your body is just going to flush it out.
Wow, thank you so very much. I'm going to pass over to the host. Thank you. That was, I thought both speakers, you guys are brilliant.
Thank you.
Been with Encapsulate for a while now. I kind of know the terms now. I'm learning day by day. So I always, please, if this is your first time here, you want to make sure that, you keep on coming. Very, very informative. Thank you so much. Flora,
Thank you.
Thank you. Thank you, guys. Right. So we're going to have something different now, just to give you guys a bit of a break. The next speaker, Yetunde, are you here? Please say hello to me if you're here. Can we unmute Yetunde, please? Is she here? I saw her just now.
I've asked her to unmute herself. So
Thank you.
you can unmute yourself, please.
It's, yeah, Yetunde. There are two Yetunde, so it's just the one that says Yetunde, I think. Oh, there she is. Hi, Yetunde. Let me just introduce you before you say hi. All right, so our next speaker is Yetunde Oladejo. She's a public health professional, a certified nutritionist, and the convener of the Girls Count Project. She holds a Master of Public Health degree from the University of Ibadan. She's a Yali RLC West Africa Ghana Fellow. Yetunde, when you come on, you can explain what that means. And she's a finalist for the Young Africa Leadership Awards, Mandela Washington Humanitarian category. Right, Yetunde, over to you. Oh, we can't hear you. Is she still on mute? Please unmute yourself. All right, okay, let me just try and unmute you 1 second. Okay, there you go. What's happening? It's unmuted her again. All right.
Hello.
Yeah, there we go.
Okay. Good evening.
We can't see you though.
Okay. I don't know. My video, it's you're not. I'm not able to put on my video again. Maybe it's from your side.
Oh, right. Okay. Anyway, go ahead.
Yeah, I've disabled it, so I'm not able to start the video.
All right, go on. You just go on.
Okay. Okay. So good evening, everyone. Thank you for having me. I am not a pharmacist. I'm just a public health person. So my name is Yetunde Adesheluka Oladejo. Like Dr. Flora said, I run
no doctor.
a project called
I'm not a doctor.
the Girls Count.
I'm a pharmacist. Ah.
Oh, sorry.
Okay, go ahead. Go ahead.
Thank you. So I run a voluntary project for teenage girls in Nigeria. Basically, they are for teenage girls in rural communities, basically teenage girls from low-income families. What the project is all about is to eradicate this issue of period poverty facing many teenage girls in Nigeria currently. I started this project about 2 years ago, and it's been a project that has reached a large number of teenage girls in Nigeria. Currently, through the project, I've been able to reach about 382 girls. And on May 6th, I will be reaching more 350 girls by the distribution of washable, reusable sanitary pads to these teenage girls. Now, why did this project start? The first time we started this project, we saw that teenage girls in rural communities, especially those from poor homes, use bed foams. It's really, really protective. We don't even understand why a girl would be using bed foams during her menstruation. We realize that some of these girls use these polythene bags as their sanitary products during menstruation. Now, we thought about this, that this is an issue that should not be so for teenage girls in our community. Now, these girls, basically, because most of their families, what they are targeting, what is most important to them most times is shelter. It's just to be able to give them the breakfast, there's no lunch, and probably something for dinner, and they're probably able to give them 1 or 2 clothes. But none of these girls have the ability to be able to supply themselves with menstrual products during their
Okay. I think she's frozen there. So the reason I invited Yetunde to talk about her project is because one of my passions is helping people, and I love to see people helping other people. And this, of course, is close to my heart. I'm a woman, and as every woman knows here, that time of the month always happens. So that's why I invited her to speak about this project, to encourage her and also for us to hear about the things that some of the young ladies are going through regarding the time of the month when they have their menstruation, and to show that there's someone out there trying to help. All right, Yetunde, you're back. Go ahead.
Okay, it's just the network. Apologies.
No problem.
So, when the first time we started this project, and we were able to provide for 382 girls. Most of the girls came to me and then told me that their parents do not provide them sanitary products. And that is why some of them cut bed foams to use for their period every month. Now, we also realize that because some of these girls are not able to provide, to get menstrual products during their monthly period, some of them are exposed to some vices. Now, for example, we met a lady who, because she could not afford menstrual product, a sanitary pad per month, would collect small amount of money from some guys, from some boys in our area to be able to buy sanitary pad at the end of the month. Now, because of this girl was exposed, at a very tender age to illicit sexual activity. That is number one. Number two, some of these girls, some of them use two sanitary pads in a month. Now, currently, the cost of sanitary pad in Nigeria now is between 400 and 1,200 naira, which is even not affordable.
Just let me try and unmute you Yetunde. I don't know what's happened there. Just 1 second. Just give me 1 second. Try and unmute you.
Okay.
Yeah, go ahead. Yeah.
So which is not even affordable for adults, let alone teenage girls that are just growing up. So the first time we provided them with sanitary pads, we provided them with disposable sanitary pads. Then we now realize that if we provide them for disposable sanitary pads for 1 month, what about the subsequent months? What will they be using for the subsequent month? Despite the fact that their parents are not able to provide them with the sanitary pads monthly. So then I came up with the idea of the washable, reusable sanitary pads. Now, this washable, reusable sanitary pad, we realized that they can use it for more than a year. All they have to do is that every month, once they are done with their menstrual period, we provide it for them free of charge. So they don't have to buy sanitary pads again every month. Now, this washable, reusable sanitary pad, once they buy it, once we give it to them, they're able to use it subsequently every month after their monthly period every month. Now, this washable sanitary pad has 5 sanitary pads inside of it and 1 storage bag. So the sanitary pads, once they are done in a month, all they have to do is to wash it with any soap or any detergent they have. And once they do that, they spread it and let it dry, just the way they spread their underwears. After they are done with that, they pack it back in the storage bag and keep it again for the next month. So we realize that this has been able to help these young girls to cut the unaffordability of sanitary pads that they face monthly. Right now, sanitary pad has become a gold in Nigeria because even adults are not able to afford it, let alone teenage girls from very poor homes, teenage girls mostly in rural communities. So that is why we started this project, and we have been doing it, and currently we'll be able to provide for 732 girls, of which we'll be distributing 350 washable reusable sanitary pads on May 6, once school resumes again. So this project is just to be able to solve this issue of unaffordability of sanitary pads faced by these teenage girls that has exposed them to so many vices, that has, turned them to things that they're not supposed to be because they could not afford disposable sanitary pad that has turned to gold, that has become so expensive in our country, Nigeria, right now. And that is why we've been able to do this for these teenage girls, and we are still soliciting for support. This year, we are aiming to be able to provide for 10,000 girls this year, of which 732 girls have been able to receive theirs. Thank you very much for having me on this program. I really do appreciate the opportunity that Mrs. Flora gave me to be able to come and discuss this issue with people, with participants on this program. Thank you so much.
Thank you so much, Yetunde.
Thank you.
There's a question for you. How do we support?
Okay, currently, most of the support I get them from my LinkedIn connections. They call me and then they support me through my LinkedIn connections. And also, you can send your support through. I can send my contact details. Yes, I'll send my contact details.
Please, post it in the chat so that everybody can see, and then whoever wants to support can contact you, or whichever way. Right. Okay. Thank you so much, and well done. Great job.
Thank you so much.
Thanks. All right.
Thank you so much, ma'am.
All right. So we can have okay, vote of hands. Should we have a break or should we carry on? I'll count for 10 seconds. Just raise your hands. Break, raise your hand. No break, don't raise your hand. Looks like people want a break. 10, 9, 8, 7, 6, 5, 4, 3, 2. Only 2 people have, 3 people say we should carry on. All right, okay. And so, no coffee during the break. I can only send you e-coffee. And I'm not sure if your medication caffeine might interact, so I need to check with my colleagues if you're allowed to have that coffee. All right, lower your hands, please. Let's carry on. Let's carry on then. If you want to grab some water or anything, just grab it and come back. But if it's in Q&A and ask you a question and you do not know, no prize for you. All right, you can lower your hands, please. Okay, let's carry on. Okay, so who's the third speaker? Let me see, where are my notes? Third speaker, right. Adebisi, I hope you're ready. You're coming up next. Adebisi is a graduate of pharmacy from the University of Ibadan and has worked as a community pharmacist for over 5 years. She's the co-founder of Mathan Solutions, a health and wellness consulting firm. Adebisi, shine on.
Thank you very much. Hello, everyone. Thank you very much for this opportunity. I'm really grateful. So let me share my slides. I really learned a lot from this. Meeting, from the other speakers. And I hope to make a brief presentation. So I'll be talking about how medicines are broken down in the body and then removed from the body. Somebody asked earlier at the beginning that, do medicines stay in the body forever? No, they don't stay in the body, although that has been answered. But I'll be explaining how these medicines are broken down in the body so that they can be easily removed from the body. So we are very familiar with different medicines. We have tablet forms, capsules. We have injections, different forms, like our speaker earlier said. And so the body actually performs some activities so that these medicines can be broken down and removed from the body. So we have different reactions in the body. We have phase 1 and phase 2 reactions taking place to actually break down medications in the body, and so that they can be easily removed from the body. So they actually, the way these reactions, I don't want to bore you with the details and with medical terms, but it's just to say that these phases are not sequential. They're not in a particular order. They can occur in any order, but they actually help. What is common to them is that they help to make the drug in a form that can easily be removed from the body. So where does this happen? This happens in the liver. That's the primary site of drug breakdown, medicine breakdown in the body. That's the major site. And this liver is one of the largest organs in the body. So it actually contains enzymes. We have enzymes in the liver that actually help to perform these functions of this function of breaking down medicines. So what are enzymes? Our speaker said earlier that enzymes are proteins that help to speed up chemical reactions. So these phase 1 and phase 2 reactions that I talked about, the enzymes help to actually speed up these reactions so that the medicines can be easily broken down in the body. So now we're going to be talking about the mechanism of enzyme activity. It's going to be a short one. We can see this is a pictorial, a visual representation of that. Let me go back to. So we saw there in that that slide that enzymes actually bind to medicines, and they get broken down into forms, smaller bits, for them to be removed from the body. So there are certain factors affecting enzyme activities. And I want us to pay particular attention to this particular slide, because it actually determines how medicines will be broken down in our bodies. So now there are genetic factors that affect enzyme activities. So for Mr. A particular enzyme can occur in a particular form. But for Mr. B, that particular enzyme can actually vary, can have slight variations. So it's very important that when someone has been given a particular medication and the person reacts to it in a particular way, it doesn't mean that Mr. B, the other person, would react to that particular medication in that same way, or the body will break down that particular medicine in that particular way. So those are the variations we have. So genetic factor is a very important factor. Hormones in the body to affect enzymatic activities. We have hormones in the body regulating certain things in the body. For some people, there's an over excretion of secretion of these hormones, and some people that are under secretion of these hormones, and it can affect enzyme activities. Age too is a factor. Age for children, we know that the liver is not fully developed in children, newborns and young children. The liver is not fully developed, and because the liver is not fully developed, the enzymatic activities are reduced in those children, and that is why for children it will not be appropriate for mothers to give a child that's supposed to take paracetamol of 5 mils of paracetamol syrup actually contains 125 milligrams of paracetamol. So when the mother gives that child 1 tablet of paracetamol, which is 500 milligrams, that is an overdose, and the child can actually experience a side effect. The liver gets overloaded with that drug, and the child starts experiencing that side effect, the side effect of that medication, because it's been oversaturated. The liver cannot break down this excess drug, this overdose, and so the child starts having the side effects. So it is important that when a drug has been recommended for children, prescribed, we should follow that particular dose. Sometimes some mothers get so carried away by how the child is feeling. Oh, this child is so hot, I had to just give a tablet. I gave 5 minutes, it's not working. No, we should actually communicate with the healthcare provider to actually know the right dose to give our child in certain situations. It's very, very important. So, and also for the elderly too, the function of the liver declines as they grow older. As we advance in age, the function of the liver declines. And so because of that, we consider, the healthcare providers consider this factor when prescribing drugs for the elderly. So it is not for them to, because we know that they take a lot of medications, because of their age. We have some old ones that don't take medications as such, but some, they have so many disease conditions and they have to take medications. But the healthcare provider actually takes note and takes into consideration the liver, the state of their liver before prescribing particular medications to them. So another factor that affects this enzymatic activity is supply of oxygen to the liver cells, where these enzymes are located. So it is very important that anything that would reduce blood flow to the liver should be discouraged. There's some disease conditions that actually reduce the blood flow to the liver. And because of that, there's reduced oxygen, and these cells in the liver are not able to, perform the way they should. So it affects enzymatic activities. Chronic liver diseases, like I said, which affects the function of the liver, can also affect enzyme activities. We have inflammatory mediators. They're just messengers that are released when there's some inflammation. Then there's an inflammation in the body. This can also affect enzyme activities. The nature of the drugs that we take also affect enzymatic activities, drug concentrations and interactions. There's some particular drugs, we call them enzyme inducers. Those drugs actually activate the enzymes in the body. So when you take those medications and you take them alongside other medications, so they tend to activate, because they activate the enzymes, that particular medication you're taking with that medicine will get broken down faster in the body. So this may actually affect the drug in a negative way, because if you expect that a drug should spend a particular time in the body before it leaves the body, and that enzyme inducer is making that medicine to break down easily faster in the body. So the person doesn't benefit from the effects of the drug as much as he or she should. So those are the effects that drug interactions have. Drug concentrations too. Maybe you're supposed to take a particular dose of a medication, and you take an overdose. It can actually make those liver cells to be oversaturated and affect the activities of the enzymes. So it's very important that when we're prescribed, a drug is being prescribed for us, it's important for us to talk with our pharmacist that, okay, I'm taking this medicine. How do I take this medicine alongside this newly prescribed medicine? It's very important we know that. Because sometimes you are taking a number of medicines, and all of them are important. Most of them are important for us. Probably we are taking it from some chronic conditions and all, and we have to take them. It's not for you to just stop one, but you need to talk to your pharmacist, and so that they can explain to you how you can space these medications properly, so that you will not suffer from the effect of one. You understand? So that the effect of one medicine will not affect the other medicine. So it's very important to take note of that. So nutrition too is a factor that affects enzymatic activities. Deficiencies of vitamins. Sometimes some people fast for a very long time. Long term fasting. Some people have been starved for a very long time, and so their body lacks some particular things, nutrients that would help to aid enzymatic activities. The deficiency in vitamin A, C, E can actually, reduce the activities of these of the enzymes. Also, highly proteinous food and low carbohydrate foods can actually increase activities of some particular enzymes. So like for example, in theophylline is a medication for asthma, and that particular medication, when you eat food high in protein and low in carbohydrates, it actually helps that particular medication to be broken down properly in the body. So it's a factor. What we eat is a factor of how medications are broken down in our body. Body temperature, to increase in body temperature also affects, as we talked about, that enzymes are actually proteins. So the temperature is actually helps, actually affects the way these enzymes actually work. For some drugs, increase in temperature will increase the activity of the enzymes, but for some other drugs, it wouldn't. So in this case, it's not for us to actually cram and say, okay, I'm taking this medication. I have to cram everything about this particular medication. No, it's not like that. Talk to your healthcare provider, talk to your pharmacist that I'm taking this particular drug, and they'll run a check on the drug. Okay, it is safe for you to take this drug. It is safe. Okay, it's better you space this drug and all. So it's very important we take note of this. And because a particular drug has been given to a person, has been prescribed for a particular person, it doesn't mean we should take that particular medicine, because the way we react to medicines, the way our body, the medicines work in our bodies have variations, and so we should really take note of that. Very important. So, so my next slide, I want to talk about keeping your liver healthy. It's very important. Like I've been talking about keeping your liver healthy, and there's no how will I say it? There's no formula than taking your medications as prescribed, as recommended. Is very, very important. Don't just take medications anyhow. You are taking some concussions and you don't know they are the right doses. You're just assuming that, okay, I think I should take just one glass. No. There's nothing about assumption. You have to know the particular dose that will take care of that particular condition so that you won't start overloading your liver. That is very, very important. And so some other disease conditions too that can affect the liver, like your blood pressure, diabetes and all. Once you go for your checkup and you see that this your blood sugar is not well controlled, your blood pressure is not well controlled, it's very important to seek medical advice so that they can take care of these conditions and it won't ultimately affect your liver. So now I'll be talking about how drugs are removed from the body. So after these medicines have been broken down in the body, these medicines will be removed from the body. They don't just get broken down like that, just like that, and they remain in the system. They have to be removed from the system. And so there are different routes. Sometimes the medicines can get out of your system through the urine, through the bile, sweat, saliva, swells, tears, milk, and stool. There's some particular medicines that get out of the system through your feces. So there's some that get out of the system through the milk. Although these are in little quantities. For the breast milk is actually in little concentration, so we may not really pay attention to that. But it's very important. This is very significant for breastfeeding mothers. It's very important. So you need to get advice. You need to get advice from your healthcare practitioners, from your pharmacist, and ask them, oh, I'm taking this medicine. Does it get secreted in the breast milk? So that you can, protect your children. Because we said earlier that their liver is not fully developed. So when you take particular medicines and those medicines are secreted in the breast milk, they can affect these children. So it's very important to ask those questions. So the major sites of removal of drug or medicine removal in the body are the liver and the kidney. Some drugs they get through from the liver into the bile and ultimately in the feces. But most drugs are actually, particularly the water-soluble ones, are removed from the body through the kidney. So you can see the kidney is a pear-shaped, the kidneys are a pear-shaped, pair of bean-shaped organs. And so many things happen in the kidney. The kidney is highly vascularized. We have a lot of blood vessels running through around the kidney, and when the medicines get from the blood, when it gets to the kidney, it goes through 3 major processes. Filtration. This actually removes little drugs like with little weights, that light-weighted actually get filtered in this particular at this particular point. Then the next stage is secretion. Secretion are the tubules that are in the kidney. So this is actually an active process because most drugs are actually secreted into the kidney, and it's through active transportation, and it requires energy. The third one is reabsorption at the tubules. This is actually a passive one too, and I want you to know that particular medications can get reabsorbed back into the body after they've been broken down. I want you to know that because reabsorption works according to the concentration gradient. So if the volume of urine is high, the concentration gradient is low, and the drug gets removed from the body easily. But when the volume of the urine is low, the concentration of the medicine is higher, and therefore can be reabsorbed back into the body. So we can say that these processes are dependent on various factors, acidity of the blood, the fluid, the clear part of the blood, that's the plasma, the volume and acidity of the urine, and the blood flow to the kidney. So it's very important. So in the case of people who are diabetic, we know that and it's not well controlled, the blood sugar is not well controlled. The blood vessels can be clogged, can be so narrow that the blood doesn't get to the kidney as it should, and therefore cause a kind of how will I say it, the kidney does not perform the way it should flow. It should perform. I mean, it should work. That means that the blood doesn't get to the kidney the way it should, and therefore you can't get the medicines out the way the medicine should get out of the system. The kidney also get overworked, and therefore some other conditions can happen to the kidney. The kidney can actually experience some form of deformity. And also exposure to some high levels of toxic chemicals can actually affect the function of the kidney. Some people take a lot of drugs. When I say drugs, they are abuse drugs, illicit intake of illicit drugs, high intake of alcohol can actually overload the kidney and also affect the way it functions. Age is also a factor. Age is also a factor. As people get older, the function of their kidneys declines. The function of the kidney declines, and therefore it's very important to check the function of the kidney. There's tests to do that. So when elderly ones go to the hospital and they want to get their medications, or the healthcare provider wants to prescribe a medication, there are actually some kidney function tests that are done to actually get the level of the kidney activity, the level of the function of the kidney, so that drugs can be prescribed accordingly. So it's very important we take note of that. So in conclusion, I would say that medicines don't stay in the body forever. That has been established. But how fast they leave the body is determined by the nature of the medicines, how they are taken, and the condition of the body. When I say the nature of the medicines, there's some particular medicines, like I said, some are inducers, some are inhibitors. Some activate the actions of the enzymes that break down medicines. Some inhibit those actions and they can affect. Then how the medicines are taken, that means that how you take the medicines, the dose you take, what you take with them. Do you take a lot of water with these medicines? Do you take food with these medicines? And the condition of the body, the state of the body also determines how these medicines will leave the body easily. Thank you very much.
Awesome. Thank you so much, Adebisi. That was great. Stop sharing for me, please. Fantastic. Do we have any questions for Adebisi?
Yes, we do. But like I said earlier before, I'd like it to be interactive. So if you've got a question, please, even if you put something in the chat, kindly put your hands up and then I'll call you out and then you can ask your question.
Okay, so sorry.
Oh, that's fine. Thank you.
So sorry. I didn't hear that.
No. It's not me asking. I'm just asking anyone. If you've got a question, even if you put something in the chat, if you can kindly just raise your hands and then I'm going to call you to ask your question. I'm just waiting. I know I can see some in the chats. Okay, the first person I'll call is Amos Ajayi. If you can read your question out, please, to everyone. Thank you. Amos Ajayi.
Just raise your hand so we can ask you to unmute. Are they still here? Are they still in the... Just call the next person and then we'll sort Amos out.
I think I've asked you to unmute yourself, Amos Ajayi. If you can just unmute, I've asked you to unmute.
Yes, ma'am. Good afternoon. Good evening, ma'am.
Good evening, sir. Go ahead.
Blessed. You are blessed. I thank you for all the contributors. It's been fantastic. I was just asking that about the issue of aspirin, baby aspirin. people said when you use it, it will thin your blood and it will make your blood flow well and carry oxygen to all the organs where it's needed. But I'm asking whether it could be overused. That's the question.
Okay, whether you can overuse the aspirin.
Baby aspirin.
Yes, yes, you can overuse aspirin. The important thing is to take the medication as prescribed by your physician. It's very important to take that. An overdose of that would be a problem. So when you take the medication, and it's not for you to just take aspirin because people are taking it. There's some things that are actually considered before prescribing aspirin for some particular people. For some people that their blood pressure is not well controlled, they control the blood pressure first before giving aspirin. So it's very important to don't just take aspirin on your own. You seek medical advice before you do that.
Thank you. God bless you.
Welcome, sir. You're welcome, sir.
Yes.
Okay, the next person is Themba. I've asked you to unmute yourself. Themba. If you just unmute yourself and ask your question, please. Thank you.
Hello, everyone.
Hello.
Hello, hello, everyone.
Hello, I can hear you.
Oh, yes, my actually, okay, I'm Themba from CV,
Okay.
as she has just said. My question is based on aspirin too. Like aspirin has been used as a blood thinner, especially to the patients who are hypertensive. So my question is, what the mechanism of action behind the aspirin tablet to be used as a blood?
I didn't get that. Sorry.
Like my question is like, what is the mechanism of action behind the aspirin to be used as the blood thinner in the patients who are suffering from high blood pressure?
Okay, what it actually does is an antiplatelet. So it actually helps blood to flow through the vessels easily. So it removes any form of obstruction at the vessels so that the blood can flow well. So have I answered that question?
Okay, yeah, I got it, ma'am. I got it, ma'am. Thank you very much. And I don't know if maybe I can ask the.
Oh, sorry, you're on mute. Hold on.
You're
All right.
muted.
Yeah.
Themba, if you just unmute yourself, I've asked you to unmute.
Hello.
Yes, we can hear you.
Yes, ma'am. My second question is actually directed to our second speaker, a person her name. It's based on the side effects. Yes, based on the side effects. If you are taking medication, let's say a patient is given a medication. I've made an example of paracetamol. Maybe the patient is supposed to take 1 gram. Like 1 gram 4 times a day, and maybe due to maybe some irritations that is feeling after taking him, he now is deciding to maybe to take it like 1.5 gram, like 1 gram, 1.5 gram, maybe 3 times a day now. So I'm asking if maybe if that X can have an effect on the side effects or.
Yes, okay. So it depends on the tablet that you're talking about. Some medications, it's okay for you to have it once or you can separate it. But certain medications, like our third speaker said, it has to be taken as directed because the liver or the kidney, whatever organ is getting rid of that medicine, can only handle a certain amount at a certain time. So for paracetamol, it really should be taken for an adult 2 tablets 4 times a day. If 2 tablets is too much, if maybe the person doesn't like how they feel, they can take a little bit less and maybe supplement with another type of painkiller that works in a different way. But I wouldn't advise you for paracetamol to take three times a day to maybe, because you may overload the organ that is trying to help you get rid of that paracetamol at that time. There are some medicines that it doesn't matter. Certain medicines, it doesn't matter whether you take them all at the same time. And that's why you need to look at the leaflet that comes with your medicine and speak with the healthcare professional, because they'll be able to tell you whether your medicine is one that you can take in one go or whether you really have to take it specifically as directed. Okay.
Thank you very much, ma'am.
Thank you very much.
So maybe I can follow up on that question. Like, usually when you are going to a hospital, you are not provided with the leaflets for each and every for the medication that you are given from the hospital usually. Okay. So how can you what can it be your advice maybe when it comes to when you advise the patient, maybe let's say he wants to divide the medication up, maybe the way I've said, like, you want to alter the dose as I've made an example of the paracetamol. So how can you advise the patients on that, especially with the medication which is given without the leaflets?
So if a leaflet is not available, a lot of the information in the leaflet is available online. So you can actually direct that patient. So when you go online, you can find information for medications that is written for healthcare professionals, but then you also find information for medication that is written for patients in a language that is very easy for the patient to understand. So if you direct them to one of those, I'll try and see if I can get some links and put in the chat box. So if you direct that patient to one of those websites, then the website will explain to them how the best way to take that particular medication. Even as a pharmacist, I don't know how all the medications work. There's no way I can remember how they all work. The important thing is that you know where to go to find the information. And once you have that information, then you can advise your patient properly. Okay, I think someone has put, Nike has put a link, and that link is very good because it has information for healthcare professionals and it also has information for the patients as well. So you can direct them to a link like that.
Sorry, okay. What country are you in, Themba, please? What country?
Hello?
Yes, what country are you in?
I'm from Eswatini.
Which country is that?
Swaziland.
Oh, okay, that's the new name for Swaziland, right? I see.
Yes,
okay.
Yes.
Fantastic, you're welcome. Now, that link, Nikki, you've posted, I'm not sure. I don't think it works everywhere. But Themba, you can try it now and see if you can access it, and then let us know in the chat. And then if not, then Ikoma can look for
I'll look around
links.
and see if I can find something. Yes.
Yeah, other links that we can share for you, okay?
Okay, ma'am.
All right, cheers.
All right, thank you very much, everyone. Moving on. I'll also say that, follow Encapsulate on Instagram. I mean, it's good we're here today, but if you want to keep up with us, follow us on Instagram and you should see us. We're going to put the Instagram handle just in the chat. Feel free, follow us, then you can keep up to date with what we have and what we have in the future for you as well.
And
so
on
I'm going to call on John, and on YouTube, yes. I'm going to call on John's iPhone. So John's iPhone, if you're there, if you just unmute yourself, I've asked you to unmute and then ask your question, please.
Is that me?
Yes, that is you.
All right. Good evening to everyone, and really appreciate this talk. Very, very informative. Yeah, it was just very quickly to ask. I mean, I know I don't want to overload you. You've already spoken about all the effects of a certain medication and the frequency of the drug intake. Just as a layperson, I just wondered how exercise impacts with that medication as well. So do the doctors do they need to take into consideration what your daily activity is? So does that differ, for example, if you are an athlete as opposed to just as someone who sits down and watch telly like me every day and does nothing.
Okay, thank you very much. Okay, you said how does exercise affect these medicines, how they are broken down, right? Did I get that right? Hello, did I get your question right?
Go on, yes.
Okay, so actually the exercise actually helps to increase blood flow. So it's a positive one when one is exercising. It actually helps your organs to function very well, and therefore helps to increase the rate at which the medications are broken down in the body and removed from the body. It increases blood, but like I said, blood flow is a factor, and exercise actually helps to increase that. So that is a positive one. Yeah, it has a positive effect on the medicine. Did I answer your question well?
Okay, I'll just leave that just for the sake of time. I'm going to move on to Mercy. Mercy, if you just unmute yourself and ask your question.
Good evening to everyone, and well done for the presentations. Please keep up the good work. My question is this: for medications such as for blood pressure and diabetes, must they necessarily be taken with water, or can they be taken with other fluid?
Who wants to take that?
Good evening, Ma. I would say it's best to take with water, just because, as we've spoken before, a lot of these medications may have interactions and things may prevent it from working well. With water, we know it's a neutral substance. If you drink it with water, you can, guarantee as much as you can that what you're drinking will not interact with your medication. So Ikwama made that example of metronidazole and alcohol. I'm not saying that you're going to take your medication with alcohol, but that's an example. Alcohol can interact with that metronidazole and cause you to vomit. With water, we know it's a neutral substance and it won't cause any interactions. Yeah.
Thank you so much for that. Just for the sake of time, I know we've got one more question in the chat, which is Dr. Salisu. So I'm going to leave that till the end. So if I just ask Flora to introduce our last speaker.
Okay, thank you all. And thank you all for being so interactive and throwing your questions as well. Keep them coming, and then we'll go through the rest of them at the end when the last speaker is done. So our last speaker, last but not least, is Mrs. Folashade Lawal. She is a pharmacist and has been in practice for over 30 years. She runs her own pharmacy, which she's also run for over 30 years in Festac in Lagos, Nigeria. She's very passionate about the rational use of medicines. She's a fellow of the Pharmaceutical Society of Nigeria. She's a Commonwealth Professional Fellow and an associate member of the Royal Pharmaceutical Society of Great Britain. She's involved in a myriad of programs to educate the public on the rational use of medicines. She's also involved in a number of research activities with publications in international journals. Mrs. Lawal, the floor is yours. Let's go. I can't see you, Mrs. Lawal.
Yeah.
There you go.
Good evening, everyone. I'm highly delighted to be here, and I thank you for the opportunity to share experiences again. It's been a wonderful afternoon, evening, and my co-speakers have done great justice to the lectures. So they've made my work very simple. Please permit me to share my screen. Excuse me. we'll be looking at using your medicines as prescribed. And my outline is this: we look at, a lot has been said about what a medicine is, so we just summarize understanding medicine, dangers of not using medicine as prescribed. Then we'll look at tips on using medicine as prescribed. So what is a medicine? We've been taking through that, but let me just summarize by saying that it's a preparation of a drug that helps to make somebody who is ill better or gets well, or prevents a healthy person from being sick. And it can be in form of tablets, capsule, injection, liquid, powder, creams, insert, patch, inhaler. And medicines are made to help our bodies recover from illnesses and protect us from falling ill. And a lot has been said about how all of this come to play, how they interplay. So medicines are formulated in different ways based on their intended routes of administration. For example, do we want to swallow them? Do we want to rub them, or are they going to be inhaled? That influences how the medicines are made. Where they're intended to work. For example, a medicine that is intended to work within the stomach will be formulated differently from the one that is intended to work in the intestines. Then when they are expected to do their work, it's also important. For example, are they to work immediately or gradually? Then how long they are expected to work for? For example, are they to work for a few hours, a few days or months, or are they meant to work? Well, there's no medicine that works forever, like we have been told. Then who's expected to take them? Is the medicine for a child? Is it for an adult? Sometimes is it for a male or female? All of those affects what we do with the medicine. For example, we have vaginal tablets for females. Of course, we cannot do that with males. So there's a lot that goes into medicines, and we need to understand this so that we'll be using our medicines appropriately. Now, apart from these different formulations that we have talked about, some medicines are used for we also need to look at other peculiarities. For example, quantity to use, then length of time to use them. Some of our medicines are made for very short periods. Some are taken at certain intervals, while some others are taken forever. That means that the patient has to be on this medication for as long as he lives. And that applies to many chronic conditions that are not curable. For example, a patient that has hypertension will likely take his or her medications forever. And sometimes we don't want to hear that, but that is the truth. So what does it mean to use your medicine properly? It means taking the right dose at the right time, in the right way, for the right length of time, and at the least cost to you, really. And this is what is usually referred to in medical terms as rational use of medicines. Now, if the medicine was prescribed by your doctor, pharmacist, or other, it means taking your medicine as prescribed. If you got it over the counter, it means taking the medicine as recommended by the manufacturer. That is whatever the leaflet says. But today we are looking at medicines prescribed. So we are talking about taking your medicine as prescribed. And this assumes that your prescription was given to you by those who are recognized by law to issue them. For example, your physician or your dentist for dental issues, or your dermatologist, or what have you. Now, taking your medicines as prescribed, irrespective of the source of your prescription. The sure way to get full understanding of how best to take your prescribed medicine is to take your prescription to the healthcare professional who is trained to recognize, who is trained or who is, and that leaves you with your pharmacist. Your pharmacist is trained to be able to relate your prescriptions to your condition and guide you on how to use, ensure that there's a rational use, the right drug goes to the right patient, and all the rights are observed. So your pharmacist will ensure that you have the right prescription for your condition. Your pharmacist will help you to understand your medications in terms of the do's and don'ts. For example, if you are on a tetracycline, your pharmacist will help you to know that will help you to understand what to do with it. Your tetracycline, you have to take it independent of food because many foods will render your tetracycline inactive. So your pharmacist will help you to itemize the do's and don'ts. Now, what's the ULA value all about? What's the big problem? It has been found out that failure to take medicines as prescribed is responsible for many medical conditions not getting better, or they getting worse. Developed countries, according to the patients, don't take their medications as prescribed. That's very worrisome. Failure to take medications as prescribed is responsible for about $100 million loss annually, and it's said to claim a life every 90 minutes. That is a problem. Now let's come down to our Nigeria. According to a study done in North Central State of Nigeria, less than half of the patients took their medications as prescribed. So let's look at dangers of not using medicines as prescribed. Sometimes you get treatment failure. Sometimes the condition worsens. Then we have avoidable hospital admissions. Patients land on admission because they didn't use their medications as prescribed. Either they've used underdose and then it's not getting effective and the condition gets very bad, or they have overdosed themselves and there's another problem. Then loss of productivity naturally because sometimes the patient gets handicapped and is unable to do his work. Of course, that translates to economic downturn. And sometimes it's as bad as death. I recall a situation where a patient was given a medication that has been formulated in such a way that it releases its active ingredients little by little over a 24-hour period. And because this patient had difficulty swallowing, the patient decided to crush the medicine and take all at once. So why patients don't use their medicines as prescribed, it's important for us to know. That will help us to address the issues. Now we know the whys. Sometimes it's due to lack of understanding of their medical condition. Please ask questions. Find out what is they are likely to comply with. Practice. I've come across a good number know that they had to take their medications for life. So many times after they have taken their medications for a while and their blood pressure gets normal, they just stop. So if they understand that hypertension, most hypertension is not curable, we only manage, and that you have to be on your medication daily to get the desired level, then they would most likely comply. Then lack of understanding of what the medicine does. You need to know what your medicine does. This is very important that you ask questions. Sometimes it's the cost of the medicines. I recall sometime a particular patient of mine that she had been very stable, her BP was fine, and then suddenly the BP was no longer controlled. And then one of the days, Mama said, look, the doctor changed her medication. She used to be on 3 different drugs, and the doctor felt that that was too cumbersome, gave her a combination of the 3, but it was a lot more expensive than if she were to take them one by one. So she now decided on her own to take this medication one every other day because of the cost. Fear of side effects. Some of us, some patients just, all they think about is side effects, side effects. They probably have read the literature and they have read all the side effects on the literature, and they imagine that all those side effects will come to bear, and because of that, they won't take the medication. Too many medications can be a problem when the patient has too many drugs to use. Sometimes it's overwhelming. Then lack of symptoms like high blood pressure, we know for most patients, there is no symptom. They don't know that the blood pressure is rising. So for many people like that, they just think that all is well. And because of that, they're not taking their medications. So when there's no symptom to let them know what is going on inside their body, they assume that all is well. Sometimes it's due to mistrust. When they don't trust their healthcare professional who is prescribing to them, then they might not want to take the medication. Sometimes it's miscommunication. I recall a situation where on the envelope, it was written 1 by 2, and the patient interpreted it to mean 2 tablets at once, while the person who wrote it wanted it to be 1 tablet 2 times a day. So there is a problem there. There's sometimes the mental state of the patient, especially patients that have mental health problems, might have challenges taking their medication. Curiosity, I've come across that a number of times. You ask me what that means. Some of my patients will tell me that I just want to know what will happen if I don't take my medication for a day or 2. When they come for their checkup and you measure their blood pressure that had been controlled and is no longer, I don't know what will happen. Then poor access to the pharmacist. Some people have difficulty accessing the pharmacy at the right time, and then they miss their medication. There are a lot more other reasons, but I just brought up a few. Now let's look at tips on taking your medication as prescribed. Number 1, ensure you take your prescription to your pharmacist so that your pharmacist will help you to interpret your prescription appropriately, help you to tailor your medication to your lifestyle. Might interfere with our lifestyle, or our lifestyle might interfere. We might have problems adjusting. Your pharmacist will be able to work that out for you. Your pharmacist will be able to look out for interactions and so many other things. So get relevant information about your medicine. Please ask questions when not clear before taking them. I recall vividly an elderly person who was prescribed in those days Afan. Afan had erratic absorption after meal, especially after fatty meals. So the manufacturers recommended that Afan be taken. Pharmacist told this elderly man 30 minutes to 1 hour before meal. But the man decided on his own to take it after meals, because as the pharmacist was telling him, according to him, he told me that later, he was thinking in his mind that this pharmacist is a small girl. She does not know that people don't take medicines before food. It must be after food. Instead of asking questions and engaging, he agreed. And then he went home, sat himself down, ate a bowl of eba with egusi soup, and then took the medicine. And then he came down with arrhythmias. And thank God, nothing terrible happened at the end of the day, but he knew what he went through. So for routine medications, please start taking medicines to daily routines. It's better to take them same time every day. If you are to take your medicines daily, for example, your pharmacist may take it tied to your breakfast, after breakfast, or after dinner, or before, whatever, so that you are able to consistently take your medications. Now check if the medicine is to be taken with or without food, and if there are foods to avoid. For example, we know that grapefruit interferes with many drugs. So naturally, we advise for drugs that might be influenced by the grapefruit to avoid taking grapefruit along with your medication. Now, before taking your medicines, draw a schedule for using it, considering the prescribed intervals between those. What this means is this: if you are on 6 to settle down and look at what is the best 6 hours interval for you. If you go to bed like 11 p.m., then that means that you start your dosing from like 11 p.m. You know that you have to take your last dose at 11 p.m. That means the next one will be 5 a.m. So you work it out like that. not just start and then you find it difficult to adjust. Then it's also good to set reminders. You can set reminders with your phone. You can use carry people at home along with what you are doing so that they help you, they remind you. You can also make use of a pill box. A pill box is available to organize medicines according to time of use. And this is particularly useful for those who take multiple medicines, what we call drug paroxysm. Sometimes patients don't remember that they are taking their drug, then they will go again to take it. Or if it's compartmentalized into boxes like this, and you have emptied the box, you would know. If you wanted to repeat it, you would know that you are taking this, and then there was no need to inadvertently overdose yourself. Whenever you are traveling, very important, ensure that you have sufficient amount of side medicines and take some extra just in case anything happens and you are delayed, you cannot come. Then if you have financial problems, discuss with your family. It's important also that you check the form of your medicine. Is it tablet? Is it liquid? Is it pastry? And make sure that you get it right. I also recall a young lady that swallowed carnosine vaginal tabs instead of inserting it. So ask questions and be sure about what to do if side effects occur, or if you miss your dose. Sometimes you just can't help it. You have missed your dose. When it happens, what do? Are you supposed to take the missed dose or wait for the next dose? It's very important because drugs are different and they act differently. For some drugs, you may need to just take once you remember and continue as it were. For some drugs, you may just have to wait for the next dose. So please ask questions at the point of receiving your drugs. Now let me conclude by saying that taking your medicine as prescribed may not only improve your health outcomes and keep you from untimely death, but also save you unnecessary costs. Your pharmacist is trained to help you take your medicines as prescribed. Always route your prescriptions through your pharmacist so that you can get the best out of your medication. Thank you and God bless you.
Thank you. That was fantastic. Thank you so much, Mrs. Lawal. So what we're going to do now is go through all the questions we had before. And if you have any more questions for Mrs. Lawal, please post them in the chat so you don't forget. So by the time we get back to you, then you can remember what question you wanted to ask. So.
Yes, I'm going to call on Dr. Mrs. Salisu first. I've asked you to unmute, ma'am. If you can please ask your question. Dr. Mrs. Salisu.
Is she still here?
She is here. Okay, if I can't unmute you, or I'm going to call on the next person, which is Yada. Yada. If you just unmute yourself, Yada.
I just wanted to ask. Okay, somebody said.
Okay, if Dr. Mrs. Salisu is ready, if you can ask first, please. I think you just unmuted at the same time.
I have to show myself. Good evening. I'm so sorry. I've been enjoying this while I'm cooking, running around. I always look forward to Encapsulate, and each time I just hear it, it's like I have caps in my pockets everywhere. I don't want to miss any program at all. Sincerely, I've been cooking, running around, and I'm actually in the meeting. So, I don't know. She always tells me to put on my video. No problem. But what I want to ask, it's been awesome. It's been wonderful. It's been very educative, and like I always say, I like to always pass it on. Every knowledge that is beneficial, especially to women, children, I want to pass it on in my own little way. So I've been wondering, I have several questions posted as they were coming in, but the last one I was going to ask Dr. Kolashade, we are our very calm educator as usual, of that. I wanted her to expatiate the difference between drugs, the vaccines, and supplements, so that we can know if, like the vitamin C, fine, is okay if you abuse it a bit somehow, not really the right word, but if you take overdose. The vaccines, the application of the overdose, and the drugs. So if you have the difference, be able to like be much more careful and know that one is more sensitive. That's just the question I have. Thank you so much. I don't know why my video is not showing. I put this on actually. Thank you so much. All the PAM on board. And each time I listen to you, I always want to go back to school and go and study pharmacy. I don't know if I should still stay back and to be a scientist or a researcher rather. Thank you so much. Yeah.
Go on, Mrs. Lawa, we can hear you.
Yeah, we can't
Okay,
hear you.
if I got you right, ma'am, is supplements in terms of overuse. Did I get that question? Okay, very tricky. Let me start have why it's imagine. If Ifeoma said, the body likes to have a balance. And generally in life, we want a balance. So there can be overuse of anything and there can be underuse. The best thing is to use as prescribed as much as possible. However, some are more forgiving than others. So with vitamins, the body might still forgive you for some excesses, depending on how the body is. For example, vitamin D, even vitamin C has overdose. It's just that it's water soluble and the body can still manage and bring them, flush out whatever is excess. But there can be overdose. So we should respect drugs. I respect drugs a lot. I always tell myself that once I put that drug in, I've handed my body over and I'm no longer in control. So I must be careful what I'm submitting to. So please, let's respect whatever the manufacturer says or our healthcare professional, trusted healthcare professional tells us about the drug. So we avoid overdose. Then with vaccines, generally vaccines are safe. They are meant to initiate immune responses. And more often than not, slight overdoses in vaccines don't harm. But then, please, vaccines have their doses. Let's go with whatever doses are recommended, and let's make sure that we take our vaccines from those who are trained to administer them and give them to us. And if we have concerns, let's ask questions. Especially once they are not live vaccines. You know, there are different types of drugs that doesn't have its side effects or level of safety. They just have different margins. Some have very high margins, some have very narrow margins, especially those drugs that you take in micrograms. Most of them have very narrow margins and you must be careful with them. So don't even attempt to overdose on them. But many of those ones that have bigger strengths can still allow for certain percentages overdose than those very tiny ones. But don't even just try to overdose yourself. It's better to go within what is allowed for you. Treatment is not individualized because your doctor will consider a lot of things. You look at your medical condition, you look at your weight. For me now, I don't take 2 tablets of paracetamol because I weigh much less than 50 kg. So I don't take 2, I take 1 and it works for me, I'm fine with it. So your doctor will consider your weight and so many other things. So please, if you have concerns, the most important thing is when you have concerns, ask questions, because my own experience with many patients is they don't ask questions. They would have made up their minds what they would do or what their friend has said. And then when they get back, they go to do it. And when there's a problem, they come running down to say, hey, this is what happened. So please let us know that drugs are very delicate. And when we say drugs, everything, supplements, vaccines, they're all drugs at the end of the day. Even our herbals are drugs. So let's respect the doses that are assigned to them. And if we think that we want to go outside those doses, let's discuss with our healthcare professional and ask questions before we go outside the doses that are recommended. Thank you.
Thank you, Mrs. Lawal. Ikoma, Nikki, Adebisi, do you want to add anything? You can unmute yourselves now. Everybody
Yeah,
should be.
I think she's covered it all.
Okay. All right. Bumin, any more questions?
Sorry, I've been trying to, I don't know, I can't find where to raise my hand. So
all right, go ahead.
Oh, thank you. Yeah, thank you so much for this. This is really very educative and informative as well.
Thank you.
I just want to ask a quick it's like trying to clarify at the same time trying to ask the question. Doesn't it matter that I'm thinking in terms of overdosing now. Doesn't the half-life, doesn't it depend on the half-life of the medication, on how quickly someone can overdose on it? That's my first question. And the second one is that how can a patient detox fully from, maybe they've just had this medication, or maybe they've mistakenly taken, more than what they should take. How can they then detox, apart from maybe drinking maybe plenty of water? How else can they detox from that kind of situation?
All right, let me start with Ikoma and then we'll go down the line according to how you are on my screen. Go on.
I think in terms of detoxing, it depends on the medication. For some drugs, if you've taken too much at a certain time, it's okay to just maybe not take the next one, and the drug will kind of, last you that period. But for some drugs, you literally have to go into hospital and get an antidote for taking an overdose. So you mentioned about half-life, which is basically how long it takes the drug to sort of break down in the body. So depending on the drug that you've overdosed on, the half-life, how dangerous the drug is, how it's formulated will actually decide what you do. If it's a drug that is fairly safe, you can just wait it out. Again, speak with your healthcare professional, and then we can check our books and see what's going on with this drug and how dangerous it is, this drug. If it's one of those drugs that you can just wait out, then we'll say, look, don't take the next dose. The overdose will kind of cover. If it's something that is very dangerous, then we will say, please go straight to the hospital. You literally need an antidote to reverse the effects of the overdose. So that, again, you have to be in constant communication with your healthcare provider if anything like that happens, because they're in a better position to advise you on the best thing to do regarding the drug. So you don't just drink water with the hope of flushing the drug out. It doesn't quite work like that for a lot of drugs. So it's all dependent on the actual medication that you've overdosed on. That's what determines what the next line of action will be.
Nikki? Thanks, Ikoma.
Yeah, so it's basically what Ikoma just said. There's a lot of drugs that have reversal agents, and you would need to go to a hospital in order for you to receive that treatment. And like Ikoma said, some drugs, you can miss the next dose. So she's basically said everything. Reversal agents, or sometimes you can just prolong onto the next dose.
Okay, that's good. She has answered this question very well. She has answered this question very well. Yeah, because in the case of
go on, Adebisi.
okay, the question has actually been answered well. In the case of poisoning with particular medications, the person may not actually be in the right position to take antidotes, because you may not have those antidotes readily available at home. So it's better you go to the hospital. Yeah.
All right, thanks, Adebisi. Mrs. Lawal, is there anything else you wanted to add?
Well, nothing. It has all been, it's been all said, because it depends really on what we have on our hands, and we have had to manage a few cases like that. Sometimes you just watch for whatever symptom comes up and manage. So it's always better to talk with your healthcare professional.
Okay. If you have a question, please raise your hand. I will come to you straight away. I've allowed everyone to unmute themselves when they need to ask a question. So just raise your hand. Okay. Yada, go ahead.
Hello, I'm
Hello.
Yada. My question was, if someone takes too much of a particular medicine, could their body like build resistance to it, and then like would the medicine be ineffective?
Okay.
I think with antibiotics, if you take too much of a particular antibiotics, your body can become resistant to that type of antibiotics. That's why we have this thing called antimicrobial resistance, where people take antibiotics irresponsibly for a headache, bellyache, not for an infection, and they keep taking that same antibiotic. And then when they actually need that drug or they have an infection, because your body is already exposed to the antibiotic, and our body, like Mikoma said, our body is very smart. What the role of the antibiotic is to kill the microorganism. Once your body has been exposed to that drug, it finds new ways of living without being killed. So if I keep taking, for example, amoxicillin for unnecessary reasons, when I do need amoxicillin, it won't work because my body has developed and found a new way to live without it. But with the other drugs, for example, blood pressure medication, diabetes medication, your body doesn't become resistant if it stops working. It might be that your body may be intolerant to it, or you might need another agent, or the disease has progressed further, so you need a different agent. So antibiotics is the one that you can become resistant to, whereas the other drugs, it just be that maybe your body is not tolerant or the disease has progressed further.
I think I was also going to add that certain painkillers work on the brain, so they don't actually do anything to the actual problem you have. What they do is they make your brain not think about that problem. So things like morphine, that's how it works. When you take morphine for pain, it almost gives you a feeling of happiness and feeling of goodness, so you're not thinking about that pain. And those drugs are also drugs that you can get used to, because you get used to that high that you get from the morphine, and you get used to that feeling of, that feel-good factor that it gives you. So you may find that if you continue to take drugs like morphine, after a while, the same dose of morphine will not give you the same effect for your pain. And then you find yourself taking more and more and more. And that's how people get addicted. So you have to be really careful with drugs that work on the brain, because it's easy for you to get addicted to it, because you forget the reason why you're taking it, because it makes you feel so good. And then you find yourself taking a lot more of those. So that's another addition to what Nick has said. That is something that your body can get used to with time. And that's why you really shouldn't take them unless you absolutely need them.
Let me say something to Yada. Nice to hear your voice.
Yeah.
So, yeah, let me add that the more you take the drug, the more the side effects, the adverse effects, especially when you are now going overboard with the dose. So when your doctor is prescribing, he has considered a lot of issues and he wants to give you the safest dose. If you now go outside that, you might be endangering yourself. Apart from antimicrobial resistance, some of these antibiotics can also damage the kidneys because they put a lot of pressure on it. So taking the drug more than your doctor wants you to take it is just very bad, and it can damage the body. Thank you, Yada, for that question. I thought I would see your face. Yada is here because of me, actually. Oh. Yada is my sweet, lovely little cousin in the UK. And she said, I must watch Auntie. Where's your face? Let me see your face, Yada. Yada, show me your face.
Go on.
Love you,
Thanks, Yada.
Yada.
Great question,
Thank
Yada.
you.
Thank you. Okay, Mercy, you have your hand raised. So what's your question?
Well done once again.
Thank you.
With regards to lifelong medications, such as blood pressure medications, how often should they be reviewed?
Anyone go on, take it.
Can I? Okay.
Okay, you can go. I've answered those questions.
Okay. They should be reviewed as often as your doctor finds it necessary. And that's why they give you appointments. Now, what they do is they want to find out what makes your blood pressure stable with minimal side effects or any form of harm. They want to be sure that we're not harming anything. So it's a process. It's not an event. It's not a once and for all thing. And that's why they keep giving you appointments to go back. But many people don't go for their appointments. Once they've prescribed the drugs and they think they're good, they just continue forever. No, the doctor wants to check, the doctor wants to be sure that your kidneys are still able to cope with that medication. Nothing else is going wrong. Your cholesterol is not getting affected, your sugar. So please, the review should be as your doctor finds it necessary. And it's peculiar to everybody. It's not a one cap fits all.
Yeah. Nikki, you wanted to say?
Yeah, I was going to say, here in the UK, the doctors will review you periodically. And if your blood pressure is outside of the range, then they may consider increasing it, or if it's less, then they will reduce it, obviously. So your GP will, or general practitioner will review you periodically, unless you go there yourself and you say, I'm feeling dizzy, I'm feeling light, or I feel like my chest is beating, or you go to them with some symptoms, then it may prompt them to do some reviews. So
Yeah, I can add to that. Yeah, that's it. All right, let me read the next question. Actually, Dr. Salisu, this was one of your questions. Did you forget to ask? You wrote here, how do you cushion the bad side effects from drugs, such as nausea, itching, etc.? How can one cushion against that?
Okay. Can I answer that?
Go on.
Yeah, go on.
Okay, there's some particular medications that we already know the side effects. Your healthcare provider already know the side effects of those drugs. They are common side effects that most people would experience. And so for those ones, like for those with gastric disturbance as side effects, like nausea, like stomach aches and all those things, you're actually advised to take those medications with food to avoid that. And so for some medications, you're advised to actually take a medication, an antiemetic, a medication that actually reduces nausea, that actually removes that side effect. So that's what happens most of the time. So if a particular medication causes a particular side effect, the healthcare provider can give you a particular medication to actually stop that side effect or minimize that particular side effect. Thank you.
Anything else from anyone?
I think I was going to add that sometimes the way the medication is formulated as well can help with the side effects. So something like metformin, if you take the normal metformin, it can sometimes cause stomach problems for some people. But if you take the metformin that has been coated, there's a way the metformin tablet can be coated, and then that will reduce your chances. So if we put a patient on metformin, for example, and after a week or so, they come and they say, look, I'm not happy, I'm having this diarrhea, I'm having all these problems, we can actually switch it to the coated metformin. And then you find that they don't have that same side effect. So again, it brings me back to what I say all the time. Speak with your healthcare provider. There is always a solution and there's always an answer. Sometimes if the liquid is giving you problems, if you go to a capsule, you feel better. So speak with your healthcare provider, and then together you can both work out a way that works for you, with, and then you don't have so much side effects. Don't feel like you have to suffer in silence or stop your medication because of a side effect.
Thanks. All right, next question. What is the danger of too much vitamin B12 in the system? Vitamin B12 in the system. Can you actually have too much vitamin B12? Go on, Mrs. Lawal.
Yeah, when you take your vitamin B12 from natural sources, you may not have any issues. But when you take supplemental ones, especially when it's injectable, if you overdose on them, you may have some side effects like nausea and all of that. So it's still better not to overuse anything at all.
Yeah, don't overuse anything at all in the first place. Another question, does drinking of palm oil or milk calm some drug side effects from stomach upset? Okay, that kind of links to the other question before. Palm oil or milk calm some drug side effects of stomach upset.
I don't know, I suppose milk would coat your stomach, wouldn't it, and protect, but the problem is some drugs will actually bind to the milk and the milk will stop the drug from working.
Absolutely.
Again, you have to ask your healthcare providers. If you take paracetamol with milk, it's fine, but if you take certain medications with milk, those medications will actually bind to the milk and won't work.
Absolutely.
So then you're just taking medicines for no reason. So, Nick has said before, if you must take your medication with water, because at least it's neutral and it's not going to affect anything. Water is probably the best thing you have. But if it's unpleasant to take with water and you want to take it with something else, just a quick phone call to your pharmacist, a quick, even if you want to search online, like I said, the link we put in, if you go into that link, pretty much all the medications that we have in this country, you get information on that medication. So when you go into that link, there's a section that you get information for patients, and that section will tell you everything you need to know about taking that drug. So if you don't, if you can't access your pharmacist or you can't access your GP, then you just check to see if it's okay to take that drug. But the best thing is always water. There are no questions. With milk, you just don't know. It depends on the medicine.
Yeah. Nikki, please, could you repost the link again? And please bear in mind, when you're using that website, not all the drugs in your country may be listed and the brand names might be different.
Yeah,
the actual drug name will be the same, but the brand name might be different. So it's better to search by using the actual drug name, not the brand name, just in case. Because not all drugs are licensed in every country. So the drug you're looking for may not be there. So just to let you be aware of that. Okay, so the next question.
Let me just say something on that question before you move on. There's actually some medications, especially for malaria, like your Atenolol, lumefantrine, that work better with milk, and you might be advised to take with milk. So please, if you have such an advice, go ahead, but make sure that that is the advice from your healthcare professional. So it's to get information about it, because some people might not just say, oh, no, I'm not going to take anything with milk. There are some drugs that are better taken with milk. And there are some drugs that their side effects are reduced with milk, like nitrofurantoin and all of that. So it's good to get information before you make up your mind what you are going to take. But when you're in doubt and you want to play safe, you're completely in doubt, the safest thing is water.
Mrs. Lawal, I thought you were going to say something about the palm oil.
I didn't know people drink palm oil.
I know.
I've never heard that before.
I have heard of people when they have a dry cough, they lick palm oil, but not with medicine. Mrs. Lawal?
Yeah, a lot of people take palm oil too indiscriminately, and palm oil can even help with absorption of some drugs. Like they've overdosed on certain drugs and they think that they want to get rid of it. They now drink palm oil. Palm oil might exaggerate the absorption of that drug, and then you get into more trouble. So it's still better to ask questions around it before you go. Please.
Yes, ask questions if in doubt, please. Okay, the next question. What is the implication of using sugar or sweeteners to change the taste of bitter drugs? How would you do that? Let me ask the person who asked the question. Dr. Salisu, do you want to expatiate on that question, please? How would you actually? Yeah,
yes.
go on.
For example, there are anti-malaria drugs that are very, very bitter. So sometimes when, especially for kids, sometimes when you have tried to administer the recommended doses and they tend to vomit then we used to have a chloroquine, now we have a Coartem and what have you. Yes, they still vomit. So what we do is for them to take the drugs, we add little sugar, when you mix it so that the children can swallow them. And so that is when they can actually complete the, because each time you go back to the hospital, the doctor keeps prescribing the drugs and madam, you have to go and give them, they have to go and take it and rest. So we had a sweetener a little bit for them to take it. I don't know. That's just it. We add a little sugar. And they're mostly anti-malaria drugs. I can't. The next one.
I don't think there's any harm in that because it's a short-term thing you're doing. So it's fine. And you can clean the baby's mouth after to protect its teeth. But it's fine for that short period. And you are not treating malaria every day. So it's fine.
There's even a song that says a spoon full of sugar makes the medicine go down. So
you've been watching Mary
a lot
Poppins.
of people do it. A lot of people do it. So it's fine.
All right. It's for a short time, not every time, please. Okay.
Thank you.
All right. Is Ayo Ogun still on? If you're on, please unmute yourself and ask your question. You posted it earlier. About replacing medication with supplements like Solrain or something. Ayo Ogun, if you're still on, just talk to us about this question. Let me see if the person is still on. You can unmute yourself. You don't have to wait for me to unmute you if you're still on. All right, I don't think the person is still on, but I'll ask it anyway. Please, is it advisable to replace your medication with some supplements like Solrain, etc., as one reads testimonies from others that they work? Now, I have no idea what Solrain is. I don't know if anyone else has heard of it. If anyone
Yes,
is on...
I do.
Okay, go on, Mrs. Lau.
We have seen a lot of that, and more often than not, they get into big trouble. You see, in medicine, we don't work with testimonies. Scientists are not, they don't work with testimony, they work on facts. And I've heard talk about this before. In medicine, 1 + 1 is not 2. You must prove it. So a lot goes into making your medicine your medicine. They would have done a lot of research and they would have come up with what dose works, how it works, and all of that. So we cannot substitute your medicine for Solrain or Soltrain or whatever we call it. They are just supplements. Most of them are just powerful antioxidants. Antioxidants are useful. They help to detoxify the body to an extent, but they don't take the place of your medication because they don't treat anything. So it's still safer. Sometimes because there are no symptoms attached to your condition, you will not know that you're already getting worse until it gets to a climax. And then when it gets to a climax, there's a problem. It might even be too late for anybody to do anything. So please, before you substitute your prescribed medicine for anything, talk with the prescriber or talk with your pharmacist. Sometimes we are not comfortable talking with our prescriber. Talk with your pharmacist. Your pharmacist will interface between you and your prescriber. I've had to do that for many of my patients. They will come and we'll just get in touch with the prescriber to say, this is what your patient is saying. And then the prescriber will say, oh, no, it can't be that way. Then we strike a balance. Sometimes it's because they have certain side effects to their regular medications or whatever. And many of the Soltrain or Sol whatever, they are a lot even more expensive than the regular medications, but they deceive you to say they don't have side effects. There's no drug that does not have their side effects, no matter how natural they are. Every drug took its origin from natural source somehow before they became chemical. I mean, the chemical components were isolated and made into tablets or syrups or whatever. So please, I plead with you because I see a lot of this in practice. Don't just change your medication without carrying your prescriber along.
Yeah, thank you so much, Ma. Thank you so much, Ma. I just wanted to add, I want to add that also supplements can actually affect your medications. Some supplements can affect medications. They can interact with the medications and make them of no effect. So it's very important we don't take supplements anyhow. We have to let our prescriber know the supplements we are taking with our medications. Very important.
True, very true. Thank you.
Thank you. Next question. Is there any drug that doesn't pass through the liver? When we're talking about metabolism and excretion. So there was the question on is there any drug that doesn't pass through the liver? Who's taking that? Adebisi or Nikki or Ikomax? Go for it, please.
I will transfer.
Yeah.
You're on mute, Nikki.
Yes, so different drugs have different mechanisms of action, and there's quite a few drugs that don't have to go to the liver to be metabolized. If you remember the beginning, we spoke about different drugs. There's different routes. So if a drug is gone through if it's gone through your anus, like a foam, for example, it doesn't need to go to the liver because it's working locally. So it's working straight at the place where it needs to go. For example, IV drips, they don't need to go to the liver, that goes straight. There's loads of different drugs that can work at different sites. So the majority of drugs are metabolized in the liver, but not every single one.
Yeah, I mean, drugs like lithium mainly go through the kidney, and there's so many others as well. Okay, so someone is asking about pharmacogenomics, which is also known as personalized medicine. Is there effort towards personalized medicine in Nigeria? I think this is one for Adebisi and Mrs. Lawal. Is there any efforts towards personalized medicine? I know there's a lot of effort going into it in the UK and the US in terms of research, but is there any research into personalized medicine in Nigeria? Mrs. Lawal? And Adebisi?
Well, I'm not sure. I'm not sure.
Okay. We're not sure about that, Dr. Salisu. I think we need to look into that and get back to you whether there's any efforts towards that.
Yes.
Okay, if anyone has a question, you can raise your hand and then we can take that now.
There's a question here by Adenike Adeni about the overuse of vitamin B12. So
we did that already.
As one of the speakers mentioned, just to reiterate, it is water soluble and there's no, upper limit to how much it will just pass through your urine. It will just be flushed out. So if that answers your question again.
All right. Another question from Themba. Do you want to unmute yourself and ask, please? Themba, you were talking about erythromycin and food and the absorption rate.
Yeah.
Hello, everyone.
Hello.
Hello.
Yeah, go ahead.
Yes, ma'am. Thank you very much for having me on the mic again. And I think this is gonna be my last time now. So let me start by recommending our speakers. Your presentation was
Themba, you're on mute. Themba, you're on mute. We only heard what you said about presentations. Go on.
Yes, I was actually recommending our speakers here that their presentation was so educative and so informative. We really, for me myself, I picked a lot of points from their presentations myself. Okay, here is the question then. Like, my question is related to erythromycin as an antibiotic tablet. Like, most of the patients, they are usually complaining about, okay, actually, I've done my little research on it. And what I found there is like erythromycin, if it's taken along with other maybe food, actually its absorption rate become disturbed, or maybe the rate become being decreased, and that's maybe lead even into its bioavailability will be affected too. So, and my question is, when it comes to these patients which are always complaining about taking erythromycin in an empty stomach, how can you advise that patient as a pharmacist when it comes to taking this drug? Or as a pharmacist, as a pharmacist, are there any alternative that you can maybe opt for in this particular condition?
I attempt it.
Okay.
Go on, Mrs. Lawala. I can speak up to you.
Okay, for erythromycin, yeah, it's best absorbed on empty stomach. But where the patient cannot tolerate it, it can be used after food and with a little liquid with milk. The absorption will just be a little bit delayed. It doesn't stop it from working. But it's better on empty tummy. But where it cannot be tolerated, it can go after food. It can go with.
Okay. Can I also add that the form of the medicine, the erythromycin, also matters. Non-enteric coated erythromycin can actually be taken on empty stomach. So
DBC, what is non-enteric coated? Please explain.
Okay, there are some particular medicines that are actually protected because of their effect on the stomach. So for the ones that are not coated, that's the non-enteric coated one, you can actually take it on them. That means they're not shielded. I don't know how to explain that. They are not, there are actually some enzymes in the stomach that can affect some particular drugs in the stomach. So those medicines can actually be coated so as to protect the drug from being damaged or from being destroyed before actually taking their effect in the body. So that's the meaning of for non-enteric coated erythromycin, they can actually be taken before food.
All right, Ikoma.
Yeah.
I don't know what you wanted to say.
I don't know what else to add. No, I think because he was asking for an alternative. I was actually going to say erythromycin is something I don't know if I'm thinking wrong, but I thought that a lot of prescribers use clarithromycin now because of the fact that you have a lot of issues with your problems with erythromycin. But I might be wrong, but I don't know why I've got that information in my head that most prescribers, as long as it's safe for that person, that they tend to do clarithromycin now, which is in the same family, but you don't have to take it as often and you get less side effects with it. So I suppose the prescriber would assess the patient to see if that is a better alternative if they have issues with erythromycin.
Thank you very much.
Thank you very much. Are there any more questions? Okay, Kathy, unmute yourself and go for it. You should be able to unmute yourself. Kathy? Unless that was okay. You're off mute, so go on. We should be able to hear you. No? All right. Does anyone else have a question? Anyone else? Okay. Unless Kathy raised her hand and I didn't see it. All right, fantastic. Well, looks like we've come to the end. As I said in the chat, if you would like a copy of the presentation, please send an email to encapsulatehealth@gmail.com. I want to say thank you so much to all the speakers, Nikki, Ikoma, Adebisi, and Mrs. Lawal. And thank you all for coming. Thank you all for staying. Thank you all for being so interactive. I hope you've learned a lot.
Yes, thank you. I wanted to say something, sorry. I wanted to say something.
Go on.
Okay, about what I was talking about the person who asked about the erythromycin absorption, taking it with food and all. I was trying to say that the non-enteric coated ones, the ones that are not coated, are the ones that may be affected, the absorption may be affected by food, with food, I mean. So it's better to take those ones on empty stomach. That's what I was trying to say. But the enteric coated ones, the absorption actually be aided because of the coat. So they don't actually, you can actually take those ones without with no regards to food. That's what I was trying to say.
Okay. All right. Thanks. Okay, so I think Kathy is going to type her question. Let me just give people a chance. If you have a question, let me know. Just 1 or 2 more minutes before we finally close. Oh, all right. That's fine. So once again, thank you, everybody. Nikki, Kwama, DBC, Mrs. Lawal, thank you all so much for being so interactive. If you have any more questions, please do, I forgot what I was gonna say. Yeah, you can email us and I will appreciate feedback from you. It's very important to help us improve, to let us know what else you would like to us to cover. And let me see, what else did I want to say? I'm looking for the link. I posted it earlier on the feedback form. So there is so many messages, it's lost in all the messages.
Sis, it's there. I've just posted it.
Oh, thank you. Right. Yes, I would appreciate you completing the feedback. It would not take you up to 3 minutes to complete that, and I'll be very grateful for you to do. And the speakers would also like your feedback, so they know what to improve on, and it also encourages them for next time when I'm calling them to say, "Come and do presentation from you." They won't run away from me. So please, 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 please do it tonight, not tomorrow. You forget, and it's bank holiday weekend here. So please complete the survey. Thank you so much. And we will sign off. Now I'm just going to stop the streaming on Facebook.